Okay, now it's growing.
We are live.
Mhm.
Hello, those of you who have joined us. We're going to wait just one more minute as people filter in. Thanks for your patience. Okay, we're going to get started now. I realize people are still filtering in, but we don't want to lose any time because we have a spectacular session planned for you today. My name is Diana Fishbein. Folks call me Denni, so don't let that confuse you when people refer to me. I am currently the president of the National Prevention Science Coalition to Improve Lives. And I also work at the University of North Carolina in Chapel Hill in the Frank Porter Graham Child Development Institute. And I am I'm part-time faculty at Pennsylvania State University. I'm going to start before we say anything with a land acknowledgement. And then we will talk about the workshop today. A land acknowledgement is our way of recognizing Indigenous presence in our everyday lives. We all have responsibility to consider what it means to acknowledge the legacy of colonialism in our history as a nation, as a community, and as individuals. In this virtual environment, where we are convening in separate spaces throughout the country, I chose to acknowledge the land where I was born in Washington, D.C. It is located on the traditional and ancestral homelands of the Piscataway and Anacostan peoples who have served as stewards of the region for generations. Washington, D.C. is surrounded by just over a dozen tribal nations and sits directly on the ancestral lands of the Anacostans, also documented as the Nacotchtank and the neighboring Piscataway and Pamunkey peoples. We gratefully acknowledge the Native peoples on whose ancestral homelands we live, as well as the diverse and vibrant Native communities who make their homes here today. We are grateful for their past and continued stewardship of this land. We also note the privileges we enjoy today because of colonialism and strive not to perpetrate colonial futurity. We are committed to supporting the Indigenous members of our community, and we celebrate their resilience, their strength, and their enduring presence. For this workshop, and for the entire series, in fact, more than a dozen organizations led by the Campaign for Trauma-Informed Policy and Practice, CTIPP, the National Prevention Science Coalition to Improve Lives, and PACES Connection, we have come together to inspire and equip a movement to create a nation that is trauma-informed and activated to tackle the sources of trauma at all levels. Sponsors of this event and, in effect, the movement are shown here. And I'll give you a second to look at our sponsors. We recognize the need for a national transformation driven by advances in research that have informed a deeper understanding of how early life experiences, both nurturing and adverse, whoops, my mouse has a life of its own, both nurturing and adverse get under the skin and influence outcomes in health, education, and economic instability across the lifespan. The science is clear. Children who experience trauma are more likely to develop mental health problems like depression and anxiety. They are more likely to have academic problems, including lower reading and math scores, as well as higher rates of high school dropout. They are also more likely to become criminal justice involved, and they tend to have higher rates of chronic diseases later in life. The fields of neuroscience and epigenetics point to a reason for the lasting impacts of child trauma on these negative outcomes. Trauma affects the developing brain and body. We see changes. I'm sorry, my mouse is not functioning properly. Sorry, we see changes in brain structure and functioning that support executive, cognition, and behavioral regulation, impairments in nervous and endocrine systems associated in regulating stress and emotions, and heightened inflammation, which is associated with many types of chronic disease. Taken together, the evidence for the toxic effects of trauma on multiple aspects of child development is overwhelming. Trauma becomes embedded in children's biology. And what is really astounding and sobering is that these effects can have an impact across the lifespan. But there is hope for the future if we band together with collective resolve to accomplish two primary goals. First, trauma-informed programs and services need to be broadly, systematically, and equitably delivered in our communities to mitigate the effects of trauma on individuals already exposed in our communities, and already exposed to so that we can attenuate the harm and foster their resilience. These biological systems are malleable in response to appropriately constructed interventions. And second, our highest calling is to weed out the sources of trauma to reduce exposure at the outset. That places the evidence on prevailing conditions in our communities, including economic instability, racial injustice, inequalities, lack of social supports and opportunities, community violence, and other adverse social determinants of health. To accomplish this goal, coalitions in every community across the country can play an integral role in informing mindsets, changing systems, and reforming policies. The movement to prevent trauma and foster resilience is designed to direct national attention towards the need to create a society that offers every individual, family, and community a safe, non-threatening, stable, and nurturing environment. Now, I want to say at this time, before we go to our other organizers of this conference, of this workshop series, that We would like for you to participate via a Jamboard that Whitney Morris is going to share with you at intervals throughout the workshop. And she will provide you with those instructions in the chat. We would like to use the chat only for major comments and statements that you would like to make that we can review later, as opposed to having everybody include their name. We have the registrants and your email addresses that we can contact you and be in touch with you about future events and announcements. So please use the chat only for comments and statements, but for questions and answers, please use that box and we will track it along the way. Okay, now Jane Stevens is next and she can share her screen. And while she is doing that, I will introduce her. Jane Stevens is founder and publisher of Paces Connection, comprising the social network pacesconnection.com and the news site aces2high.com. Stevens has been a health, science, and technology journalist for more than 35 years. She worked for newspapers, magazines, and TV stations. Her articles have appeared in the Boston Globe, the New York Times, the Washington Post, the Los Angeles Times, and the National Geographic. She began reporting about the CDC Kaiser Permanente Adverse Childhood Experiences Study and the other 4 parts of PACE's science in 2005. She has lived and worked in Kenya and Indonesia and has been to the Antarctica in the winter 3 times on reporting fellowships. Jane, take it away.
Thanks, Denny. I appreciate the introduction. And thank you all so much for attending and participating. We've got quite a crowd and we're so happy about that. As Denny said, my name is Jane Stevens. I'm founder and publisher of Paces Connection. And until a couple of days ago, I was also CEO. As of Wednesday, I am only founder and publisher, and Ingrid Cochran is the new CEO of Paces Connection. And she's going to be taking us through the next few years as we scale up the organization from 450 to 5,000 communities. That actually sounds like a lot, but it's actually just a drop in the bucket because there are 34,000 cities and counties in the US. So 5,000 is approaching a tipping point where we all want to get. Ingrid has been on the staff of Paces Connection for 4 years. I'm just getting my start. There we go. And first as one of our community facilitators and then director of the Cooperative of Communities. And she's an expert in historical trauma, Black psychology, PACES science, and developmental psychology. And I think we're in really good hands with Ingrid leading us for the next few years. So today I'm going to provide a short overview of the basics of what we call PACES science, the science of positive and adverse childhood experiences, and why it's important. Also the remarkable state of the PACES movement and why we want you all to join this amazing endeavor if you aren't already part of it. And at this point, you probably have heard about the science of positive and adverse childhood experiences, and you know that this knowledge is changing everything, and it pulls together and weaves into a mighty movement, the threads of changes that have been attempted in many sectors for generations. And now we actually have the ability to make the changes we've been wanting. At the crux of this movement are 2 very simple but important concepts. We're changing all of our practices and policies from blame, shame, and punishment in trying to change human behavior, whether it's criminal behavior, unhealthy behavior, or unwanted behavior, to understanding, nurturing, and healing. Knowing about PACE's science shifts completely what people believe about themselves, resulting in a mind shift about how we see ourselves and the world. We weren't born bad. We weren't responsible for the things that happened to us when we were children. We coped appropriately, given that we were offered no other ways. It kept us alive. And most important, we can change. You can also say the same thing about families, organizations, communities, and nations. For example, a traditional child welfare organization that is integrating PACE's science can say, our organization began with hope and optimism. It wasn't responsible for the environment in which it was created. It coped appropriately given the restraints put on the organization, and we can change the organization and the environment. There's no question that PACE's science is the foundation to understanding and eliminating our most intractable problems. We're already seeing many examples of how people are doing this every single day. There are quite a few schools around the country that no longer need to suspend or expel students. A health clinic in Pueblo, Colorado saw a 30% drop in visits to the emergency room. In San Diego, during the first year of a juvenile detention facility built to be trauma-informed from the ground up, there were no violent incidents whatsoever. After 1 year, family courts that integrated the Safe Babies Courts approach, that integrated PACE's science, saw 99% of the kids suffer no further abuse. All this is pretty remarkable, and there's lots of examples in every single sector. Name a sector, and there are lots of people who are already making significant changes. And in my role as publisher, by the way, I'm going to get to do more writing, and so I'll be able to do more stories about all this. So there's no doubt that the ACE study is an easy door to go through to begin to explore all this. But there was a lot going on before the ACE study was published. That story, the evolution, is for another time, but for this presentation, it's important to know that around 2012, give or take a couple of years, among leaders of the movement, PACE's science gelled into what it is today, an interlocking matrix of 5 areas of complementary research: the ACE study and subsequent ACE surveys, how toxic stress damages children's brains, which is the neurology of brain science, and how positive experiences can actually strengthen children's brains, how toxic stress from ACEs affects our short and long-term health, how we pass ACEs from generation to generation through our genes and epigenetics and systems and historical trauma, and how resilience research shows that our brains are plastic and our bodies want to heal through implementing positive childhood experiences in the form of protective factors and resilience building practices based on PACE's science. So the ACE study, I'm just going to go through this pretty quickly since probably most of you know about, but there's a few things that I want to point out that are important. It looked at people who were mostly white, had been college educated, and all had jobs in great healthcare because they're part of Kaiser Permanente. Here are the 10 types of childhood diversity that the ACE study measured. And these are essentially the original 10 questions. The findings are that the more ACEs someone has, the increased risk of physical and mental health problems, as well as unwanted or undesirable behaviors or criminal behaviors. People with high ACE scores are more likely to be violent, to have more marriages, more broken bones, more drug prescriptions, more depression, more autoimmune diseases, and more work absences. The impact is quite amazing. And this is why it's really important for the medical community to learn about this so that they can start understanding what's happening with their patients in a more comprehensive way. Besides all these impacts, without intervention, those with six or more ACEs have a lifespan that's 20 years shorter than someone who has 0 ACEs. So I'm going to go through some myths about PACES science. The 2 biggest myths are that it's just about the 10 ACEs in the ACE study. It's about so much more than that. And that it's just about ACEs, adverse childhood experiences. First one, Anda and Folletti recognized that there were many other ACEs than those that they chose to look at, including racism, bullying, a father being abused. But they settled on those 10 because they were identified as common in a pilot study of about 300 people that had been done before the ACE study started. And several of the adverse experiences that chose to list had been investigated quite a bit before they launched their study. And since the original ACE study was done, there's been many other surveys and studies. Many of those have expanded the types of ACEs. And based on what we know, that any experience that causes toxic stress can lead to an ACE. And that's whether it happens in the family, in the community, or environmental adversities, such as our lovely pandemic that we're having to deal with. The experiences listed in these 3 parts of this infographic all have the potential to cause toxic stress and affect children's brains, and how they recover depends on the supports provided them during and after the experience. Another myth, excuse me, physical and sexual abuse are the worst ACEs. The brain actually cannot distinguish between different types of ACEs. Once the experience goes into the brain, it's just different levels and durations of toxic stress that make the difference, as well as the supports and nurturing that goes on during and after that experience. The ACE study showed that on a population level, it doesn't matter what the types of ACEs are. An ACE score 4 that includes divorce, physical abuse, an incarcerated family member, and a depressed family member has the same statistical outcome as an ACE score 4 that includes living with an alcoholic, verbal abuse, emotional neglect, and physical neglect. So that was a surprise to Folletti and Anda. And that's why the whack-a-mole approach to say we should just focus on physical abuse or we should just focus on sexual abuse or emotional abuse is not going to do the trick in eliminating things. You end up playing whack-a-mole if you do that. You have to focus on educating hearts, minds, organizations, systems, and communities about PACES science and implementing healing centers practices. Another myth, you don't need to learn about PACES science if you're becoming trauma informed. We know that there are organizations that skip over the ACE study and include a little bit of brain science and go right to implementing trauma informed care. But that approach is not going to get an organization to be as successful as it could be if it integrated PACES science. Being PACES science informed is the bedrock, the foundation of becoming trauma informed. You need both. PACES science is the what and the why. Trauma informed is the how. If we do only the how, becoming trauma informed risks becoming a fad, especially if we're implementing trauma informed practices without PACES science. And it only shows a slight improvement. I'm already actually starting to see some pushback, which is kind of interesting. But that's why we don't want this to be a fad. We want to be integrated in everything that we do. So why PACES? mainly because it's so much more than resilience. We always included resilience as one of the 5 parts of PACES science, but emerging research shows that positive and adverse childhood experiences are intertwined in a profound way that affects us and how we integrate this science into our work and lives. Now, I'm going to radically simplify an important aspect of this research and focus on some work that was led by Christy Bethel at Johns Hopkins University. She and her team, her research group, measured these 7 positive childhood experiences. And you can see that they're a mix of family as well as community positive experiences. I'll let you take a look at that. Now, what they found was partly what you would expect. Basically, the more positive experiences you had, the better off you were. A high ACE score doesn't mean you're doomed. And basically, the more positive experiences you had, the better off you were. A high ACE score, but a low ACE score doesn't mean you're in the clear. Let's say you have only 1 or 2 ACEs and 1 positive childhood experiences. The research shows that you may suffer worse effects than if you had more ACEs. That positive experience piece is very critical to this, but it turns out there's more to the story than that. There's a paradox. You have to integrate the positive and the negative. In fact, if you do not acknowledge and integrate the adversity that's happened to you in addition to the positive, you'll have more problems. But if you do integrate those, you're more likely to heal. This applies to an individual as well as a nation. For example, think about how we're addressing racism in the United States and white privilege. Many people say, okay, we acknowledge slavery and now let's move on. But slavery and its aftermath, such as the Jim Crow era, still affects so many parts of our society, policies, laws, norms, and culture, that if we're to heal as a nation, we have to acknowledge and address all of slavery's generational legacies so that we can have an equitable and shared structure. Think about your own lives. Was your understanding of ACEs and positive childhood experiences when you were 13 the same as when you were 20? Probably not. When you were 30 and had your first child, when you were 50, it changes and you learn more about yourself as you grow older. And the same thing happens whether it's an organization, a community, an individual, or a nation. And the goal of integrating this is flourishing. And these are the important parts of flourishing. And if you are able to integrate positive and adverse childhood experiences, you're going to have a pretty healthy life as you keep going and living along. Now, there's so much more to this, including the 2 big HOPE projects that are going on in this country, one out of Tufts University and one out of Oklahoma. And we don't have time to go into that here, but I think that we'll be doing some of that over the course of this webinar series. So it's critical that organizations acknowledge and examine their own ACEs and PACEs burden, because having each member of an organization do their own ACE and positive experiences score anonymously will show you where you are. And so, for example, we did this in Sonoma County at a meeting of health professionals, and you can see the burden of ACEs was much higher than the ACE study itself. And if you do this for your organization, again, being anonymous, but you can see what the organization is dealing with, and it should inform your organization on giving you some guidelines on how to get healthier. A couple of other myths. Since ACEs happen, this is a myth. Since ACEs only happen during childhood, we have only to focus on our resources on kids and we'll solve all our problems. But the research shows that parents pass their ACEs on to kids. So you have to involve parents. And a lot of people who have been doing this work for a while said, we were trying to focus on the kids first, and it was a mistake. We needed to focus on the adults first, and then the children will just model the behavior of adults. So, and research has shown that if parents address their ACEs, learn about PACEs signs and get help, they get healthier, and as a result, their kids get healthier. So back to what causes ACEs, toxic stress. And since toxic stress appears in the community and in the environment, parents won't get as healthy as their kids need them to be until the organizations and systems they work for and interact with, the communities they live in, and the nations they're part of stop traumatizing already traumatized people and start instead healing. The early PACEs science pioneers have shown that we can solve our most intractable problems, but we won't solve our problems unless all these entities start integrating this science. A second myth: we only need to address ACEs in poor people of color because they're the demographic with the highest burden of ACEs. It is true that people of color, poor people of color, have the highest burden of ACEs, but only focusing on people who have the highest burden exacerbates the them-us situation we're all in. And this is short-sighted. ACEs, as we know, are everywhere in all demographics, and people in power, which in the United States are mostly white men who come from middle class and upper middle class backgrounds, can and do act out their ACEs by abusing people individually and by policies they create, either in organizations they lead or in the positions they hold in public office. You can find many examples of leaders in the business, faith-based, healthcare, entertainment, political, and other arenas who have done so and are doing so due to their own ACEs. So while we're doing all we can get to equity, we need to create our own systems so they address everyone's ACEs. Otherwise, we'll be playing whack-a-mole here too. So there's so much happening now in the what we call the PACEs science movement. Some remarkable developments. Last year was that Oprah and Dr. Bruce Perry came out with this book, What Happened to You, which was on the New York Times bestseller list for several months. This book, I think people tend to forget about it once they in the PACEs movement tend to forget about it once they've read it. But it's been on the New York Times paperbacks bestseller list for more than 3 years. And this week it's number 2. Last week it was number 1. And if you haven't read it, it's a good one to read. In its week-long debut in May, 4 million people from more than 200 countries watched this really amazing documentary, The Wisdom of Trauma. There are several initiatives, campaigns that are starting, and one is this one about your ACE number. It's a 2-year, multi-million-dollar national ACEs campaign that was launched last year, trying to reach, if you haven't heard it, it's very likely that it's because the demographics that it's reaching are people who don't know much about PACEs science. States are beginning to be quite active in this arena. This is New Jersey's statewide public awareness campaign. California has a campaign to get every pediatrician in the state to screen their patients for ACEs. There are quite a few other states, and you'll be hearing about them over the course of this webinar, including Delaware, Pennsylvania, Oklahoma, Oregon, North Carolina, Louisiana, many others that are developing initiatives, and they're absolutely everyone is a little bit different, so that we can all begin learning from each other and how to spread this the best practices quickly. In 2019 and 2020, dozens of states enacted nearly 60 laws and resolutions that specially reference adverse childhood experiences or trauma. Going back to 2011, when the first ACE bill passed in Washington State, over 130 laws and resolutions have been passed, including 9 just last year. These are all the states that are collecting PACES data. In 2009, only 6 were, so we've made a lot of progress. So we want you to become part of all of this. We have been doing this work since 2012. And now we have 54,000 people who are members of PACES Connection. And our goal is to reach as many people as possible to learn about this life-changing, system-changing knowledge. We have more than 430 communities with cross-sector initiatives. There are many other networks that are doing stunning work, including the sites in the Center for Community Resilience Network, Vital Villages, Virginia's Trauma-Informed Community Networks, Pittsburgh Neighborhood Network, the Mobilizing Action for Resilient Communities. Over the next year, we're going to be adding layers to this map so that we have a true map, the movement map, so that we can show how powerful we all are and have become over these last 10 years. We are working with CTIPP and others to create partnerships of communities, initiatives, and organizations so that no matter where you live, who you work for, or what your interest is, there's a place for you to be part of this movement. Thank you for listening. If you have any questions, please email me, jstevens@pacesconnection.com, and I'll be glad to assist. And I look forward to meeting you if I haven't met you, and I saw lots of familiar names in the people who are participating in this. So thanks for being there, and I hope to see you soon. I'll turn this back over to Denni.
Thank you so much, Jane. That was spectacular for giving us the foundations that really carve out the narrative for what we're doing here in this workshop series and moving forward with the national movement. So it was really excellent and instructive. I'm going to introduce now Dan Press. Dan Press is going to talk about the future of the movement. For over 40 years, Dan has provided legal and Washington representation assistance to Indian tribes, Indian organizations, and companies doing business with tribes. Dan has used his years of experience working with tribes and private sector companies to assist his clients to develop productive business partnerships with tribes so that their projects can move forward quickly and cooperatively. Dan serves as pro bono counsel, general counsel for CTIPP and the Roundtable on Native American Trauma-Informed Initiatives. In November of 2018, Dan received the Public Advocacy Award from the International Society for Traumatic Stress Studies for outstanding and fundamental contributions to advancing the social understanding of trauma. And he is the author of a how-to handbook on creating comprehensive, integrated, trauma-informed initiatives in Native American communities. Dan, please take it away.
Thank you, Denni. Jane's presentation just made it clear how this movement has done so much over the last 10 years. It is just spectacular. And it's thanks to Jane, and it's thanks to everybody on this call the hundreds of trauma-informed coalitions and the thousands of individuals who are practicing. So thank you for what you've done. The question is, where do we go from here? What's the next stage for the movement? CTIPP, the PACES Connection, and the National Prevention Science Coalition have come together with a proposed path forward that I want to lay out to you over the next 15 minutes to get your thoughts and get your input. And to summarize it quickly, what we're proposing is that the movement now needs more structure, and that what we need is something like an association of state and local trauma-informed coalitions brought together under the umbrella of CTIPP, PACES Connection, and NPSC to focus on having a national voice and to focus on a vehicle for the individual local coalitions sharing and growing from each other. So I'm going to get into that, but I wanted to give you a picture of what I'm going to be talking about. To figure out where we need to go, first we need to figure out what our goal is. And our goal is, as Jane indicated, we want thousands of communities to have trauma-informed cross-sector coalitions that are working with every sector in their community to implement trauma-informed practices, and to do so in a way that is coordinated. So as members of the community move from one sector to the other, there's consistency in the way they're being treated, from the school system to the justice system to the work system. So our goal is, and it has to happen at the community level. Each community is different, and each community needs to design its own approach and its own priorities. So our goal is to build as many of those and to make them as strong and vibrant as possible. The question is, what do we need to achieve this goal of having thousands of trauma-informed coalitions? Well, first, we need technical assistance on how to create and strengthen a coalition. And that's what this workshop, the series of workshops, all about. It's to help you strengthen or build your trauma-informed coalition. And we hope it will produce many more beyond the 450 that Jane identified so far. But in addition to that, there's a need for three things that we think a national association can provide. First, there's a need to connect the local coalitions so that they're sharing their experiences, sharing their data, and sharing their excitement, so you don't feel you're alone. PACES Connection has been doing a great job on that, and we think it needs to be expanded. There needs to be a real network where it's not just individual coalitions around the country, but it's a network of coalitions, almost like a string of Christmas lights that goes on as hundreds of coalitions light up. Secondly, there needs to be a national voice, a presence in Washington. Congress isn't everything, but it has a couple of things that are really valuable to the development of local coalitions. One is it has money. And we all know that local coalitions struggle to find funding. So there needs to be an effort to get Congress to create a steady stream of financing for local coalitions. Secondly, as local coalitions encourage members of the different sectors, the school board or the chief of police or the head of the hospital, to become trauma-informed, it would be help if the federal funding going to those entities required or encourage them to implement trauma-informed programs, so that you get Washington saying become trauma-informed at the same time the local coalition is saying. And the third thing that's needed is a strong voice at the state level. I see Dave Ellis on there from New Jersey. More and more states are creating statewide entities, and there's a need for state coalitions that consist of a statewide office supported by all of the local coalitions in that state. So there's a grassroots component as well as a statewide component. So those are the three things that are needed. The question is, as we go forward, so the future, our view is the future ought to focus on how do we make those three things happen. And CTIPP and the National Prevention Science Coalition and then PACES Connection have come together and said, we're going to create a national association of state and local trauma-informed coalitions that bring everybody together to accomplish exactly those three tasks. First, it will link in a more formal way all of the state and local coalitions so you can share information. One of the critical pieces, there's not enough data out there right now showing the success of trauma-informed programs. They're anecdotal, but there isn't really that much data. We need all of the coalitions around the country to come together and start combining their success stories so we can persuade Congress, we can persuade state legislators, you can persuade your own local sector leaders. And secondly, there's a value in coming together to support each other, to realize you're not just all by yourself out there, but you're part of a national movement. And finally, they need to come together to create a grassroots movement, to be a national force. We've seen that happen with AIDS, we've seen it happen with anti-cigarette efforts, and that needs to happen with trauma-informed programs, and it needs to happen from the grassroots up. So the first goal of this national association is to create the connection among the many different state and local trauma-informed coalitions. PACES Connection has been really leading the way with that, and of the three organizations, they will take the lead in moving that forward to the next step. Secondly, there's a need for a national voice. As I've indicated, Congress has a couple of valuable things to offer. And CTIPP and National Prevention Science have lobbyists in Washington that walk the halls of Congress talking about trauma. But we know that for a national organization to be effective, it needs to have roots in the community. You need to walk into a senator or a congressman's office and say, by the way, one of our members is a coalition in your district or your state, and they are supporting this. So what we need is a national voice, which composed of these three organizations that walk the halls of Congress, but with a membership of hundreds of local coalitions who are doing the work at the local level, talking to their congressmen and senators to get their support at the local level at the same time the three organizations are working in Washington. So we need to create a trauma-informed advocacy presence, and that involves the two elements I've mentioned, the state and local entities working at the local level and the three national organizations working at the Washington level. And third, we need a state voice. We need a strong voice in every state. And that again comes from a combination of a statewide entity. As Jane indicated, more and more states are creating statewide programs, either nonprofit program organizations or entities created by the state government. But either way, they need to be the lead in the creating a state voice, and they need to have the backing of the many local trauma-informed coalitions. And the national organization will be working with those state entities to help them become strong voices, giving them talking points, giving them advice, helping them build their state coalitions. So where does that lead us? It leads us with action items. We want you to, if you haven't already, become a website on PACES Connection. We ask that your state or local trauma-informed coalition become a site, and that will make you part of the network, and the network will grow from there. To join the national voice, the three organizations hopefully at some point will come together and create a new national organization or a new coalition. But right now, CTIPP is taking the lead on that. So we're asking you to consider joining this National Association of Local Coalitions by signing up on the CTIPP National Campaign. Jesse just put the website for the national campaign. You sign up there and you will become a member of it. As a member, we're going to solicit your ideas on what you think needs to happen in Washington. And then we're going to come back to you and ask you to help advocate locally. So we're going to have a team effort, a local and a national team effort making it happen. And third, we encourage all of the local coalitions to come together and support their state coalition. And we ask the state coalitions to consider creating some kind of entity that will allow the local coalitions to be a power in the state. So the three action items are join the PACES website, join the national campaign, and put together a powerful state coalition that combines your statewide entity and your local entity. What we're really saying is that the next step for the trauma-informed movement is to get some structure. It's been a wonderful, exciting process watching it grow. It now needs to have some formalized organizations to make things happen, and that's what we're suggesting. We look forward to your thoughts on this, your suggestions, your criticism, and most importantly, to your participation, because this can only work by your participation. It'll only work if all of the 700-800 people on this call and all of the 450 local trauma-informed coalitions and the many state coalitions join in and provide the national voice. So thank you. It's exciting to be part of this, and we look forward to working you on this next stage of the trauma movement. Denny?
Thank you so much, Dan. I'll go ahead and introduce Jesse. Jesse Kohler is a consultant for the nonprofit think tank ANS Research and serves as executive director for CTIPP. His lived experiences of developmental adversity and complex trauma decided the career journey he has embarked upon. Jesse has experience advocating for trauma-informed practices at the international, national, state, and local levels. The first several years of Jesse's career were spent working directly with communities in Philadelphia through nonprofit organizations, one in a Philadelphia public high school and the other a Philadelphia community center. And the relationships he developed and lessons learned are the foundation for his ongoing advocacy work.
Thanks so much, Denny. There were a lot of great questions in the chat as Dan was speaking about what does a coalition look like? What are we supposed to do? And we couldn't be more thrilled than to have the 5 panelists that are about to join us for this next panel to discuss just that from their perspectives. Like Dan said, it can look any number of ways, right? However many thousands of communities as there are going to be that many thousands of different looking coalitions. It depends on the populations, the needs, and the resources available for each. Though there are some through lines for every trauma-informed coalition that you will hear as well. We are thrilled to have Dave Ellis from the Office of Resilience in New Jersey, Mandy Davis from Trauma-Informed Oregon, Father Paul Abernathy from the Neighborhood Resilience Project and the trauma-informed community development work that he does, Jennifer Brinkman from Alive and Well Communities, and Dr. Colleen Bridger from San Antonio, Texas. You'll see that there's great geographic diversity. There's diversity in terms of state versus community work here, nonprofit versus governmental, and diversity in terms of our speakers as well. So we are so thrilled to get into these presentations here. Please continue to put questions into the Q&A. For those that we're not able to get to, we will work to answer as many of them on the back end and have an ongoing Q&A document as this workshop series continues. But with that, I want to turn it over to the wisdom of our panelists and speakers today. Dave Ellis, if you don't mind starting us off with the work that you do in New Jersey, that would be greatly appreciated.
Excuse me. Thank you, Jesse. And I will say good morning. I still have 5 minutes left on my morning here in Mesa, Arizona, where I keep looking and it says it's 82 and sunny. And so what does that really got to do with New Jersey? It's that I fled for a while so that I could be warm. But all joking aside, thank you for the invitation to be here with you today. The Office of Resilience in New Jersey is an interesting program, organization, whatever you want to call it. We're very, from my perspective, we're a unique organization in that we are a public-private partnership created with 3 foundations as the base and a statewide agency, the Department of Children and Families, helping to give advice and a place literally for this office to land. Even though we are not part of a state agency, our responsibility is across all state agencies in New Jersey as a liaison. And yet it provides a place for us to actually be. And no, I will not have a PowerPoint for you. All of this information, trust me, there are places where you can find every bit of this information. I know the CTIPP has an awful lot of it currently. This office, in its being unique, the one thing that carries through as a thread is community. The one thing that we wanted to make sure of, and I remember Jane saying it, I heard Dan say it, I heard Jesse say it, I've heard everyone who's spoken already say this, that we have to figure out how we engage with community. And from my perspective, it's the one piece that we constantly talk about, but truly haven't done. And one of the things that as we started doing this work in New Jersey was to figure out how do we actually connect with those who are most directly impacted, and not just in a way that they are providing us with information, but how do we put them in a position to be decision makers at every level across what we do as an organization, across what happens in state government, in state agencies. The Department of Children and Families is redesigning how we do child welfare in New Jersey to make sure that the voices of children and families are leading the design and implementation of policies at a state level. That yes, there are laws and things to get passed, but that there is direct input and decision making at all levels. When we started this, we did what everyone else did. We created a statewide action plan. We launched it just a little over a year ago. Well, yes, so we're coming up on a year, February 4th, we will have launched that. You saw Jane put up a quick slide about our statewide awareness campaign, Actions for ACEs. And if you go to actionsforaces.com, you'll find all types of resources that you can utilize. Take them, download them, make them your own, do what you need to do with them. And so for us, part of this work is sharing the knowledge that we have. Right, so everything that we learned, our belief is we don't own anything, the community owns everything. And so we give everything that we do away so that the community has control over that. We created a technical assistance center in partnership with the community, and the community basically told us, we don't like the term trauma being in the name, and it's more than a technical assistance center. And so instantly the community decided that they wanted to change what we did and how we did it and what we were looking at to something called Healing New Jersey Together. And it has become the new way of talking about the trauma work in New Jersey, is that it is about healing New Jersey together. The partnership is now a partnership that looks at grassroots, state level, at nonprofit, everyone having a seat at this table and doing this work. We're in a strategic planning process, which is really interesting because the strategic planning process is designed around the self-healing. If you're familiar with the self-healing communities model, and if you're not, if you go out to the Robert Wood Johnson's website, you'll find an entire article written by Laura Porter there. We took that methodology, that design, and that is what we're building our strategic plan around, which is how do we do this work in partnership with community with community leading. We redesign right now, we're looking at redesigning how we distribute funds across the state of New Jersey. We've been doing it the way that we have for a very long time. The state issues RFPs, which are very difficult to read and understand. The process will often drive programs away from what they actually do in order to line up with the money. Rather than taking that stand, what we have done is we went to community and said, what works? What would work for you so that we can redesign? They helped us design a process that the state can accept, but is more friendly to those in the community, including individuals. We launched that. It will come fully on board. We've got about $3 million as a pilot that we're going to do. And we've got other state agencies wanting a different type of a system. Once we know how well this works, we'll share that also. We'll give you the basic roots of what that is. Take it, do what you need to do with it to make it your own. And what I think the message more than anything that I am trying to get to in this is the importance of community. I woke up this morning and as I was talking with the other panelists, I said, I don't want to be Dave Ellis today. I said, I want to be Leo Tolstoy today. And the reason I said that is that Leo Tolstoy said, my wife constantly puts things in front of me that I have no idea of what they really mean at the time, but they always seem to be perfect for what I'm getting ready to walk into. And the thing that she put in front of me this morning is a quote from Leo Tolstoy. And Jane talked about this a little bit this morning about how we see ourselves in the world, right? When we're talking about PACES science. Leo Tolstoy's quote was, everyone talks of changing the world. No one talks of changing themselves. This work is very personal. I've been at it long enough now that I've trained in just about every situation in every place you can imagine and found that the work is the same regardless of where I go. That if I don't do my own work first, it's really difficult for me to help others do their work. It's something I learned early on in doing this. But as I sit, and you know, I've heard Father Paul talk a number of times, and you're going to hear this message again, this community thing. It's not a fad. It's not going to go away. My belief is that the only sustainability for the work that we are trying to do sits in community. For that very reason, we have not moved this into as a part of a state agency. We want to keep the Office of Resilience. And if you're trying to figure out how to get to me, it's pretty simple. Just go to any New Jersey state website, type in Office of Resilience, it'll pop up, or we've got a PACES connection page that's specific to New Jersey. And typically I have someone from my staff who was with me that's always popping things into the chat. Talk with Jesse and he said, nah, don't worry about it. We'll make sure everyone has it. So if you're trying to find us, don't worry about it. The information will come to you. Okay, and I will tell people, I don't really like PowerPoints. I like being the PowerPoint. Okay, because if I have to have a PowerPoint, I get distracted by pictures and things really easily. Okay, I think if there's anything that I want to leave you with in this conversation, it is just the belief that all of the work that all of us are doing is having an impact. What I'm doing from my perspective is the way that I think it ought to be done. What you're doing is the way you think it ought to be done. And you know what? That's the beauty of this. We have so many different ways of doing this work. The only real thing we have to keep in mind is that it's people-oriented. We can't forget that this isn't truly about systems. This is about the harm done to real individuals, right? And so how do we make sure that as we do this, we stay focused on that? And Jesse, I know I got to be getting close to that 12-minute thing you told me I could have.
You got 4 minutes, Dave. Keep sharing your wisdom with us, please.
Oh God. I always worry when people say those types of things. It's, how do I say this in a way that makes total sense? And maybe I won't worry about that. And just suffice it to say that the work in New Jersey is totally designed from community input. When we did our statewide action plan, we went to community and said, this is what we want to do. What do you think? Is it something that's important? The community said, yep. Oh, I see somebody did it. Thank you, Carrie. The work is way too important. And if you look at our statewide action plan, what you're going to see is community voice throughout, because the 5 pillars that we're working on were all 5, there were 5 things that the community said, these are the 5 things you need to work on. Do these 5 first, right? And come back and tell us every year how well this is working for you, because we'll help you redesign if we need to. And you know, the interesting thing, they didn't ask for anything. What they told me was, thank you for asking before you went and designed and then brought it back and said, hi, I'm from the government and I'm here to help you. I just think from my perspective that government has a role to play in this, don't get me wrong. Government is really good at bringing things to scale. Funders, and I've been really clear with my funders about this, do what you do best. Fund. Don't try to be ingenious or innovative. Leave that to community. Fund and allow the community to do what it does. Trust that the community knows the answers, and that if we can stay the course and stay in that road, in that rut, as I like to refer to it, we will get where we need to go in the end. Thank you for giving me space and place this morning to just share a few things. You can contact me at any given point in time. I find myself in places that I never intended or thought I would ever be at this stage of my life. I told someone the other day, I turned 70 at the end of last year, and I've been trying to figure out how to go rest. How do I retire? And I thought back to a mentor of mine who looked at me one day and said, Dave, when you find a blending of role and soul, you found vocation, and you'll never work another day in your life. And it was absolutely true. Parker Palmer was probably one of the most influential, and still is, influential people in my life. I just don't know any other way of saying it. If we don't do this, what else can we be doing? Thank you, Jesse. Thank you all.
Dave, thank you so much. Incredible. And as a 28-year-old, I feel the same way, and I'm so glad to be able to follow in your footsteps that you've laid out. I talk often about how we need community-owned, trauma-informed, prevention-focused, and healing-centered work, and I think that your presentation there perfectly outlined why that is. Because you introduced Father Paul in your presentation, I figure that we will hop over to Pittsburgh to the Neighborhood Resilience Project. Just so folks know, I don't mean to be rude, but to keep us going on time, I have a timer for each person. So if someone goes over and I end up having to intervene to give them 1 more minute, I wish that we had more time in this session, and there is so much more that everybody could expand upon. We will continue to share resources. But just so folks know, if I have to hop in, that's why. But Father Paul, look forward to hearing your presentation next.
Jesse, thank you so much. It's so good to be with all of you. What great admiration and respect. And Dave, I certainly appreciate the shout out and everything that you've done in your work and the wisdom that you shared. So today I've been charged with the task of introducing the work of trauma-informed community development that the Neighborhood Resilience Project spearheads in Pittsburgh and the Western Pennsylvania region. We are faith-based grassroots community organization. And I will tell you, our qualifying expertise for this work is none other than the love of our community. This love of the people who suffer in our community is what has qualified us to do this work. And early on, I had often got the question, what qualifies you to do this work in community? Whereas we in community have very often seen very qualified experts come into our community and sow seeds of damage. Having asked ourselves the question, who qualified you to do work in our community? People have qualified themselves. This is a new era. It must be a new era in which, just as Dave said, we must turn to community, in which we understand communities have the solutions necessary to help us heal, help us build resilience, and help us achieve healthy community. As we talk about community development, it's certainly a hot topic in many communities around the United States, especially as many communities go through a different kind of renaissance. This question of what really do we mean by community development in the United States? And so often it is the case that when people talk about community development in the United States, they're usually talking about real estate and jobs, real estate and finances. This is what generally people are talking about when they talk about trauma-informed community development. But really, we have to look beyond that narrow definition, which I would say is a very American definition. If we go around the world, this concept of development is much more comprehensive. Yes, we have to talk about real estate. Yes, we have to talk about jobs, but we also have to talk about healthcare. We have to talk about agriculture. We have to talk about the environment. We have to talk about education. There's no sense in building a new school if the children are not healthy enough to go to that school. So if we really reorient our understanding of community development as a process, a grassroots process where community members can come together and take collective action to generate solutions to common problems. And we understand then that community well-being, we're talking about well-being in a comprehensive way, is the result of this process, that we must broaden our understanding of community development. Now, what really does this mean, especially in the context of trauma in our communities? As you see, this concept of trauma-affected community. And this is a term that we use in our work, trauma-affected community. And what really does this mean? Very often when we talk about PACEs, when we talk about ACEs, we're talking really in the context of individual. But what we've learned in our work is that individuals belong to community, that individuals comprise society, that individuals contribute to culture. Yes, we are a product of our environment, but we are also producers in our environment. And so there is this notion that if we have culture communities in which trauma is disproportionately experienced, that disproportionate experience of trauma will begin to create a culture, begin to create a worldview in which it becomes difficult to implement interventions that result in healthy health and well-being. And so we see here trauma-affected community, where we acknowledge that the lived experience of trauma impacts meaning making. How people understand the world is in the context of their experience, their lived experience of trauma. We're talking about the complex interwoven web of systemic issues and variables that continue to influence disparities in overall well-being of community. That there is just this constant pressure coming from all kinds of places that begin to shape life in the community. And of course, that it can be passed down from one generation to the next. And we think in the context of a shared experience of suffering that characterizes the personal experiences of many in the community. So that is to say that not everybody, I will talk about my neighborhood, the Hill District in Pittsburgh, predominantly Black neighborhood. If you come here to the Hill District, it's not that everyone's lost a son to gun violence, but everyone knows somebody who has. It's not that everybody's been incarcerated, but everybody knows somebody has. Not everybody's been evicted, but everybody knows someone who has. This is no exaggeration. This is a completely accurate characterization of life in our community. So it's not about only what I have experienced. It's what about our social network has experienced. It's about what we see all around us. It's about the vicarious experience of trauma through our life and relationships in our community. It is a shared experience of suffering. I know that when many people were talking about George Floyd, many people in our community, they thought that could have been me. They saw themselves in George Floyd. This reminds me of John Lewis, the late great John Lewis, who, looking at Emmett Till lying in the casket, said he looked at Emmett Till, 15 years old at the time. He was the same age, around the same age, and he thought that could be me lying in that casket. There is this sense of seeing ourselves in the other, seeing ourselves in the one who suffers, that is widely experienced here in trauma affected communities. It's a layering of traumas, not a singular event, and a layering of traumas that could contribute to a culture, a community culture that's informed first and foremost by trauma. That is to say that there are cultural norms that are informed first and foremost by trauma. Trauma becomes the foundation upon which the community worldview is laid. So this takes us to trauma-informed community development. And what we really are talking about is beginning with the lived experience of trauma, both personal and collective. And often we understand that there's a lot of negative impact from the experience of trauma. And yet some of the wisest, some of the most beautiful, some of the most inspiring, some of the greatest jewels of humanity have come out of suffering. We have learned that our elders, through all of their suffering, have garnered a great wisdom that must be leveraged, that even in the context in this suffering, and even sometimes as a result of this suffering, we have resilience that needs to be leveraged in the face of this trauma. And this is where we begin to acknowledge that in the community as a strong foundation upon which this work can be built. We also talk about trauma-informed community development, not as a model, but as a framework. As Dave said, there's many different ways to do this. And what we have to understand is, although we can talk about building a house, there are many different ways to build a house. Houses look very different. We just need to know how to use a hammer. We need to know how to use a screwdriver. We need to know how to draw design plans. And so become proficient with the skills, with the processes to help us develop the model is what is necessary to help communities achieve great success. And that's why we talk about this as a framework, not a model, a framework that establishes and promotes resilient, healing, and healthy community so that people can be healthy enough to sustain opportunity and realize their potential. And let me just say here, we've seen a lot of people get jobs and lose jobs. We've seen a lot of people get housing and lose housing, not because they're ignorant or stupid or malicious. It's because they are not well, because the experience of trauma have impacted their health. They are not healthy enough to sustain opportunity. We cannot just create opportunity. We have to help people be healthy enough to sustain opportunity. And so community resilience is the objective by which in trauma-informed community development can help us build that community resilience and achieve that end. Now, when we think about the arc of transformation in trauma-informed community development, we think in really these three ways. We think in terms of community support, health and well-being, and leadership development. And community support is where we really acknowledge the point of crisis where people are in the community. Sometimes people have a challenge thinking of these long-term goals and objectives in community because they are thinking about trying to pay their light bill. They're thinking about their son who's going to trial next week. They're thinking about their house that just got shot up, et cetera, et cetera. So we have to begin at the point of trauma, at the point of crisis where we engage community members and make trauma and make community development real to them by addressing the crisis that they personally are in, which then gives us the ability to begin implementing strategies around health and well-being. Once we engage, then we can begin that healing process, and by relationship begin to teach skills and implement interventions that help build resilience in community. Which leads us then to the third pillar of this, which is leadership development. This is how we're talking about people. Once we engage them, once we heal them, then they themselves become empowered. It's not enough to be a voice for those who have no voice. Brothers and sisters, we've got to help people who have no voice be a voice for themselves. And I have learned that helping people heal, that when people find their voice, it is an indication that they themselves are in fact healing. We train behavioral health community organizers. It's a trauma-informed approach to community organizers who can facilitate year-long targeted strategic interventions, community-based interventions to help achieve this transformation in community. We have community members who are trained trauma responders to respond to acute crisis, whether it be especially gun violence, homicides as a result of gun violence. Community members who are trained, who become themselves the response. of course, community health workers and even community health deputies, that is very rapidly deputizing community members in a moment of crisis so that we can very quickly build an infrastructure to address crisis in crisis that is even sometimes unexpected in our community. We have some national work that we're doing. We have a Trauma-Informed Community Development Institute where it's an intensive week-long training session where we have cohorts from around the country who come and spend a week with us and train in this framework. We have a summit that we've just started to launch in partnership with CTIPP. Jesse has been an extraordinary partner in this, where we're taking an annual reflection on trauma-informed community development and working to launch and promote, sustain a national trauma-informed community development network. Our website, www.neighborhoodresilience.org, is where you can find us. It is a great honor and blessing to be here with all of you. And I say that just as the civil rights movement and many movements like it did not happen simply by chance, but rather by intentionality and organization, dare I say, brothers and sisters, that this movement happened in the same way, in the same spirit, and certainly with the same love and hope. And with that, I thank you for your time. Jesse, back to you.
Father Paul, thank you so much. We continue to build this movement from the grounds up, and it takes individuals and communities to be able to do so. Thank you for speaking to the human infrastructure that we need to build. So often we build the infrastructure that we can physically see instead of that which we can feel. And then you can see the benefits of that as we see actions throughout our society. And so thank you for sharing all of that and for all of the work you do. I look forward to our continued partnership as well. I learn from you every single time we have the chance and opportunity to speak. We'll continue moving further west in our presentation. So next up in the Midwest is Jennifer Brinkman from Alive and Well Communities. Jennifer, I turn the floor over to you.
Thank you, Jesse. It's a pleasure to be here with everyone today, and thank you to CTIPP and all the hosts and sponsors of this event. And it's been a pleasure working with Dan and Jesse in particular as we've built Alive and Well over the years, and we're excited about what's to come. And also happy to see some of my Missouri colleagues on here with us today. So I'm going to tell you just a little bit about Alive and Well and how we came to be. I think as we think about doing this work in coalition, we think about what's our origin story and how did we get started. And I think this work for us in Missouri started with a really motivated group and passionate group of volunteers in Kansas City who formed Trauma Matters KC. And that eventually became Resilient KC with the Mobilizing Action for Resilient Communities grant that they were part of. Meanwhile, we were on the other side of the state in St. Louis working on this thing, Alive and Well STL, that was born out of a community group working on health disparities. And we're trying to figure out how do we finally bend the curve in health disparities in our community, and came upon the research of trauma and toxic stress. We were doing the work and funded by some local initiatives, and then the MARC grant in Kansas City, and that funding was coming to an end. And our host organizations, which were the Chamber of Commerce in Kansas City and the Health Commission in St. Louis, said this work has gotten bigger and the scope is bigger than our organizations. This needs a home. And so we formed this nonprofit, Alive and Well Communities, in 2017. And gave a lot of thought about how we build this from the community up and don't just build another nonprofit for the sake of a nonprofit, but how do we create something that gives ownership to community? The nonprofit, legal structure proved to be the best option, although not an ideal option available to us. And so we began to think about how do we create governance that keeps custody. So we have steering committees in Kansas City and St. Louis where we started, which is where the most important work takes place, where the community priorities are identified and the cross-coalition work happens. Those steering committees then have representation in our board of directors. We recently expanded to Southeast Missouri, which we fondly call the Boot Heel region in Missouri. That region is a very rural community with very high need. We just believe we can't change systems in Missouri without engaging rural Missouri in this work. This is not just an urban issue. Trauma pervades in all of our communities. So we work with our steering committees in each of those communities. We recruit our volunteer ambassadors from across the state to do this work. And again, for them to hold us accountable to ensure we're leading the work in a way that's most responsive to community. We also are a member of the Building Community Resilience Collaborative at George Washington University and their Center for Community Resilience, and greatly enjoy that partnership and work in the framework of the pair of ACEs, and believe that we have to change those community conditions in order to address the adversity in childhood. Sorry, I'm having a problem advancing these slides. We have, again, across the state, just to give you a sense of scope, about 500 ambassadors, 20 staff members, about 15 contracted community consultants who work in the neighborhoods to, again, build resilient solutions in those neighborhoods for what does it mean in those neighborhoods for them to address the trauma that they're facing. We've reached more than 450 schools. That's the sector that's been most engaged with us since the beginning, and have provided trainings that have reached more than 35,000 people. So that just gives you a sense of the scale and the interest for the work. Our mission that you see here on the screen is something that we have really spent a lot of time working with our stakeholders and continue to work on today to make sure that we're guided in a way that most authentically connects us to our purpose. And so our mission of activating communities to heal, we say we have to do this together by naming racism and systemic oppression as a trauma that impacts the well-being of all. If we don't name this, we're not addressing it. And we learned that lesson the hard way. And today we're very clear that we must name racism in particular and systemic oppression of all kinds to be able to move towards healing. And we have to disrupt that in order to get the generational impact that we want. Again, elevating community wisdom, and those solutions that we want to advance are based in the science of trauma, toxic stress, and resiliency. As we've been doing this work, we've been on this journey of exploring how our trauma work interconnects with the anti-Black racism work that needs to be done, and how do we bring that forward? And especially in a state like Missouri, both rural, urban, and a lot of competing philosophies about how we do this work. We have landed on these statements as our guidance for moving forward, that all communities experience harm created by trauma, including the trauma of anti-Black racism, regardless of community composition. And healing is possible only when we understand this trauma of anti-Black racism and white supremacy. And that true well-being is possible when systems and communities work together. And I'd say that part about systems and communities working together is a sort of our organizational philosophy, that we have to support systems in becoming trauma-informed, but community has to be at the table guiding that transformation. And I said we're still on our journey of making sure that we're doing that in a way that's most impactful and accountable to our communities. And then again, the self-work that's been referenced, living in ways that lead to healing and well-being requires our own personal commitment to listening and unlearning. And then acknowledging that self-care and rest. We've been on this journey for nearly, as an independent organization, not to mention the work before us, for nearly 5 years. And it's hard work. And the trauma that you're up and close and personal with through this work, we find it necessary that we build in our own self-care and rest. And my limited time with you, I just want to share some of the lessons learned in this journey. I thought that might be more helpful than kind of going through everything that we do. One is that I think we started with everyone wants training. If we could just get the word out and train everyone. And we realized pretty quickly how insufficient that is. It's necessary, but it's insufficient. That we have to become skilled at managing change and helping push through transformation in multiple settings. We do use the Missouri model for trauma-informed care as a framework for our work with systems and institutions, which is foundational. But we also need to understand how our work in systems has to connect to change work in communities, and that we're doing that in partnership with community. And then we also find that we have to go deep, just helping people see the aha moment of trauma. We have to continue to apply that lens in new ways to help people deepen their learning and understanding. This is just one example from this year of helping schools understand how to apply the trauma lens to learners with intellectual and developmental disabilities. Also, elevating the wisdom of those most impacted. We work on this every day to make sure that decision-making is based on the power of those most impacted. One of the ways that we're evolving and to get stronger in this is really centering youth voice in terms of them holding us and our schools accountable to the work. We've just started some trauma teams inside high schools that are led by the students themselves. And we expect the work to become far more impactful with them at the lead. And then a youth advisory board that's working on their policy requests in Jefferson City for what school safety really means to them, which is not the same as what it often means to adults. We do need to work at the grass tops and in systems and with change agents in those systems. And we have found success with bringing change agents to the table with community to then help leverage those types of institutions. So this is the Missouri Hospital Association that we're working with right now to advance trauma-informed care in the hospital systems across our state. Also find this opportunity to join the critical issues that the community has told us are important to them and use the framework that we call build, connect, and activate of building, understanding, connecting to people, to one another, and then taking action. And this is just an example from this year on immigrant rights, where local community from Wyandotte County on the Kansas side of Kansas City came to us and asked us to be part of a coalition around immigrant rights. And we hosted conversations with our ambassadors, and our ambassadors even testified to improve the rights in that county using the trauma lens. So again, helping others see the issue from a different angle. Finally, another lesson that I've learned personally is recognizing how our trauma and our identity impacts us and our impact on the movement. So as a white person doing this work, I couldn't skip this step at all. It's not enough to have good intentions. Our country's history requires that we dig deep to understand how that history impacts how we show up and how we're leading the movement, being involved with the movement. And then finally, the lesson learned is invest in building the team and have fun and focus on relationships and the trust, understanding the power and the privilege that we all bring to the team and how we do that work together, including investing in our own self-care with one another. So there's a lot more that you can learn at our website, and I welcome dialogue with any of you. Thank you, Jesse.
Thank you, Jennifer, so much. And the importance of engaging youth voice and every voice and building that team to help drive the work forward. It's got to be more than one person. It needs to be everyone. And so that point is so well received. Thank you for all the work you do. I must admit that I looked up how far west San Antonio was from Kansas City, Missouri, and not very far west, but very far south. And so we only go slightly west and much further south, hundreds of miles south, to Dr. Colleen Bridger to talk about the trauma-informed work that she's been leading in San Antonio.
Thank you. Let me pull up my slides. Hi, everybody. Thank you for this opportunity. I will jump into it because, like everybody else, I have way too much stuff to share. So today I'm going to talk at a pretty high level and very briefly about the work that San Antonio and Bexar County is doing to achieve their vision of being a trauma-informed community. And just for reference, San Antonio is the 7th largest city in the United States, and Bexar County has a population of over 2 million, which actually makes it larger than over a dozen states in the United States. So just want to kind of level set with what our foundational guiding principles are when it comes to what we mean when we say trauma-informed care. I'm not going to read this. I'm sure y'all are familiar with it, but it was really important to us that we clarify what we mean. And that's going to be a theme that weaves throughout this entire presentation. So we had a group of community members come together in 2018 and talk about how we were going to address ACEs. And what we decided we were going to do after spending the day together is that we were going to focus on children and families, that we were going to focus on a multi-sector approach, which ultimately involved 12 different sectors where children and their families interact with other adults. We decided that we were going to take a systems approach by helping each of these 12 sectors become trauma informed. So we were very excited that we had coalesced around all of these through a very diverse group of community members. And we started rolling out what we were going to focus on. We were going to really help people understand how to walk across the ACEs bridge from where we are to how to become trauma informed. And it was really well received. I think our timing was perfect. Everybody was really interested in it. And it was the perfect time to do this. Unfortunately, though, what we found was that there really wasn't a clear understanding of what it meant to be trauma informed. And so what we found was that there was a tendency of organizations to say, oh yeah, we're trauma informed, without really clearly understanding what that meant. And even if they had the best of intentions, there wasn't a standardized understanding in Bexar County of what it meant to be trauma informed. And so that made it really hard for us to understand who we were and to understand what we needed to do in order to kind of advance the movement. So we went back to the drawing board, brought even more community members together and said, okay, now what are we going to do? We've got a bunch of people excited about the fact that trauma-informed approaches are a really great way to address the challenges associated with ACEs, especially from a systems perspective. And I should say my background is in public health. I was a local health commissioner, a local health officer for 30 years when I started doing this work. And so we decided, again, the community came together and said, all right, so here's what we're going to do. We're going to create a system. And this system is going to focus on the why, the what, and the who. And so I want to just walk you through what our system looks like, again, at a really high level. So if you look at the first component, which is the South Texas Trauma Informed Care Consortium, this is an organization, completely volunteer organization. We have about 750 individuals, over 300 different organizations that have joined this consortium that focuses on why. Why is addressing ACEs important? Why is trauma-informed care important? This is a big, big group. We have 3 tri-chairs. I am one of the tri-chairs. I am joined by 2 other amazing, capable women, Dr. Fletcher, who runs Voices for Children, and Yvette Sanchez, who is COO of the Children's Shelter. The Children's Shelter was the only organization in Bexar County that was certified in trauma-informed care before we started this journey. I mentioned the 12 different work groups. Here is a list of what those different sectors are. And you can see it ranges anywhere from the justice system to hospitals to faith-based organizations and even philanthropy. And, you know, we involved philanthropy and other funders because, like others have said, we want to make sure that as funding becomes available for work that's important that it be trauma informed, that funders recognize that importance and actually have that be a requirement of their funding. So that's part of the vision of the work that we have brought to this system. So the next aspect of the system that I want to talk about is the Institute for Trauma-Informed Care. So the Institute for Trauma-Informed Care is a $1.2 million partnership between the City of San Antonio and San Antonio's public hospital, University Health System. This institute provides training and technical assistance on how to become trauma-informed at no cost to organizations that wish to be trauma-informed. I've included the website for you. I do want to point out that this partnership is really unique, to have a city and a public hospital actually put skin in the game, by which I mean money in the game, to work on something like this is very unusual. And the commitment of each of those organizations is also worth noting. So the city of San Antonio has committed within the next 5 years, 100% of all of their departments, some 30 plus departments, will be certified trauma informed. That includes their police department, their fire department, their health department, et cetera. And then University Health is also actively working right now on becoming certified in trauma-informed care. That will make them the first hospital here in San Antonio to achieve that certification. So I do also want to just kind of put the timeline in our minds as well. All of this launched in January of 2020. And the two primary drivers for this work were the health department at the city and the hospital. Both of them had kind of a heavy lift during the pandemic. And so the fact that they were able to continue to move this work forward in spite of the all hands on deck approach that all of us had to take to address the pandemic over the last 2 years, I think is really a testament to how important this work is for all of us. So the third component of our system is a certifying entity. And the certifying entity focuses on who is trauma informed. And to accomplish this, we partnered with the Ecumenical Center and Methodist Healthcare Ministries. Methodist Healthcare Ministries funded the Ecumenical Center to develop a center for trauma-informed care certification. To start, they developed the certification standards. Again, remember in the beginning, I said part of the problem was nobody really knew what it meant to be trauma-informed here in Bexar County. And so we set about developing those standards and what that standardized language was. And then they developed a process for certifying organizations as trauma-informed. We created 3 different levels of certification. This is all based on existing national organizations that provide trauma-informed care certification. But you can see that there's 3 different levels. Right now, we have completely developed the standards for level 1, and we are certifying organizations at level 1. We are currently finalizing the level 2 certification standards, and we'll start to move organizations once they've achieved level 1 certification to the level 2 certification. I should mention here that we have, so again, this started late 2020 with actually moving organizations through the certification process. And we have 2 organizations who have completed the certification process. It takes 12 to 18 months. It's a very rigorous process. It is provided at no cost if you are an organization that serves individuals from San Antonio and Bexar County. We also have over 50 different organizations that are a part of 3 different cohorts that are going through the certification process right now as we speak. Again, this is kind of the overview of how it works. One of the most important things to us was making sure that the trauma-informed care certification process was trauma-informed. So it's not, if you've ever been through JACO accreditation or anything like that, that is not what we do. It's very participatory, it's very involved, and everybody is able to kind of provide their input into how to make this work. So also, I probably get the most questions when I give this presentation about the certification process. And so I do want to just pause for a second and point out that the way the process works is organizations that decide that they want to be certified will go through a self-evaluation tool. And during that self-evaluation is when they will identify areas where they need to continue to do some work. They will then connect either with the Ecumenical Center or the Institute for Trauma-Informed Care to get access to additional resources and technical assistance to help them develop in those areas that they identified themselves as needing to be improved. Once they've been through that self-evaluation process, they've gone through their plan of action, they've implemented everything, then they'll invite the Ecumenical Center into their organization and they will perform the certification assessment. This is my last slide. It's very, very busy. I apologize for that, but it's one slide that summarizes everything that we have here in San Antonio. So it covers the different system components. It shows how the different system components work together. And it also allows me to remember to say that we also have a governance council that's part of this system. And so the governance council oversees the 3 different system components to make sure that all of us are working, in tandem towards this ultimate goal of a certified trauma-informed care Bexar County. So with that, that is the end of my presentation, and I will turn it back over to you, Jesse.
Thank you so much, Colleen. And I love the 3 sort of dimensions that you spell out for your work. It's clear and concise. And it's funny, people were putting in the chat, well, who certifies? And then you answered, and then people were like, oh, I should have been more patient. Patience is a virtue, but I was wondering the same thing the first time that we spoke. And thank you for spelling out that important partnership piece as well, right? The partnership with the hospital system and the university that's allowed for you to get funding is a great example of non-foundation partners and non-governmental partners that have a stake in this work. Last but not least, we're going up and further west over to Mandy Davis in Oregon at Portland State University.
Thank you, Jesse. Please interrupt me if technology is not working or you need to have me stop talking. So I still have like 12 minutes before it's noon. So good morning before it's noon. Thank you for letting me be here. Thank you so much for the other panelists for all the work happening. I'm going to jump right in also because of time. I also want to say I talk really fast normally, and even more so when I feel an immense responsibility to represent all of the people and magic happening in Oregon, which is what I'm going to try to do today in a few minutes. So I really encourage you to write down questions, ask for more information. This will go too fast. It'll be overwhelming, but hopefully it'll just give you some ideas. And I think what's exciting is you'll see some themes throughout these presentations this morning. So I'm going to jump straight into our history, not the entire history, but I actually just want to jump straight to the Children's System Advisory Committee that you'll see here. So this is a group that in 2012 gathered and said to the state of Oregon, you're missing the boat on trauma. So they made trauma as part of their kind of priority in their work. And then they wrote a white paper. And the reason I want to start here is that the Children's System Advisory Council is made up, 51% is made up of family and youth who've been involved in the children's mental health system or the family mental health system. And I say that because it really grounds and centers our work in the voice of the people. So we were developed out of that voice, and we continue to find ways to make sure that voice is being centered and funded and invested in. So out of that work of CSAC, the Oregon Health Authority Addictions and Mental Health Division was the name at the time, created a trauma-informed care policy. That policy in 2014, which we're actually getting ready to hopefully update, you can read the policy. It was developed by people with lived experience. It's probably the only policy I've ever enjoyed reading. But a couple of things that stood out was that it said we want people to be knowledgeable. Any licensed behavioral health entity in the state of Oregon needs to have knowledge about trauma and trauma-informed care, establish a standard of care, increase access. And then for the first time in my career as a social worker, it actually in a policy called out the mitigation of vicarious traumatization. So it acknowledged the workforce as part of the work that needs to happen. So out of all of that work, the leadership at the state, CSAC, and the voices of the people and state legislators in 2014, Trauma-Informed Oregon gets kind of birthed and funded out of legislative mandated money. And so for those of you who are like thinking about planning, it was a legislative mandate, but then like 2.5 years later, we became part of the Oregon Health Authority budget. So Trauma-Informed Oregon. So our mission is a commitment at the state level to promote prevention, to bring policies and practices into better alignment with the principles of trauma-informed care while supporting equitable and inclusive service. We're primarily funded by the Oregon Health Authority. We also have grants and fee for service and some other things that fill out our budget. I guess what I really want to say is that it's important to know is we are solely focused on organization and system change. So some of you maybe have heard the phrase of like, it's not, what's wrong with you, it's what's happened to you. I like to think it's like, what did the system do to you? So we're really focused on kind of the harm caused by organization, system, policy, and practices, and how to use trauma-informed care and PACES science to shift that and do that differently, to rebuild, to redesign, and to redo. Well, kind of who is trauma-informed Oregon? And I always struggle with this. So as I'm talking today, when I say the word we, I mean a collective we of a lot of voices and people, and again, feel a whole lot of responsibility to be true to those voices. We have a steering committee that's representative regionally, as well as sector, as well as experience. We have the Oregon Trauma Advocates Coalition, which is a young people's coalition that advises trauma-informed Oregon, as well as does work, kind of their own projects and work that we fund and invest in. We have kind of the collaborative, which is over 600 people who are just engaged with trauma-informed Oregon through a variety of ways and gatherings. We originally came together as a partnership between Portland State University, Oregon Health Science University, and Oregon Pediatric Society when we were first funded. Those partnerships have shifted over time, but that was pretty important at the time because at the time TIO was funded, healthcare reform, healthcare costs was kind of front and center for Oregon legislators. Staffing wise, we're about 6 FTE. And then we spend a lot of money we invest in contractors and local experts and that type of work, knowing that no one entity can be the voice of this work. So that's been pretty important. And if you know anything about universities, I hear Dave in my voice and others, we had to really think about, we have to challenge how we fund things and really how to get money out of big bureaucracy and into community. So that's been a fun thing to do daily. I'm going to quickly review 4 of the things that we kind of focus on, really just with our intention and the way we approach the work. So implementation accountability. Here, what we're really focused on is listening to what organizations needed and trying to be super responsive to that. So we spend a time and investment in going in community. What do you need to do the next thing as the movement has shifted and kind of grown immensely, trying to catch up to that. So we've developed tools and resources, but really focused on community need. And then 2 things I will say to you as we develop resources at Trauma-Informed Oregon, we do kind of 2 things. We try to develop them generic enough that they can be used across systems so that you can modify them, download them, make them yours, as well as trying to make them specific enough to be helpful. So that's something we pay attention to, from a standards of practice to a logic model. And, and those of you who've been in the movement for a while, these things have evolved over time, which has been kind of fun to see. Community building is another kind of bucket of work that we spend time in. We really have our major goal here, right, is to just connect communities and people so that people can share their learning, they can partner on work and grants, they can advocate together, and they can inspire. One thing I would say that Trauma-Informed Oregon really held on to was that there were already great national resources and entities, and we didn't want to be redundant or repeat that. We really wanted to be additive to what communities in Oregon needed. So if you look at our website, if you look at our newsletter, it is the voices of people in Oregon. It's projects in Oregon, it's needs in Oregon. And that's very particular so that we are kind of meeting that particular need. We also spend time, we value as a core value of the staff and of all of the work here in relationship. And I know that sounds like words we use a lot, but we actually put money into, funding coffee and funding lunches and funding time together so that we can really hear what's actually needed. I think mirrored to some of the other folks' conversation, we did not want to be this new funded entity that comes in and tells you what to do. So we have really worked to slow things down, and that has sometimes we've needed to do that differently with funders to be like, well, no, we actually can't write the grant ahead of time until we talk to the people about what they want the grant to be. And so really shifting that conversation with funders has been fun to do. And I think funders really have stepped up to that. But really thinking about when we say value relationship, what does that actually mean? Another core area that we work in is education and training. So 2 whole goals here we have is building local capacity for education and training. And the second thing is to advance knowledge and practice. So local capacity is, train the trainers, online offerings, funding different voices and people of community to be the person in the community sharing knowledge. And then when we talk about advancing knowledge and practice, it's paying attention and listening to what's next? What do we need to be embarking on? What do we need to be involving, right, as we do the work? At Trauma-Informed Oregon, it's what we've kind of really stepped into over the past couple of years is this kind of intersection of diversity, equity, inclusion, anti-racism, and trauma-informed care. We saw a couple of years ago and heard and experienced that the kind of trauma-informed care actually being harmful to the work of diversity, equity, inclusion. And so we stopped and kind of, and I'll talk more about some resources and Jesse can provide that we're really kind of stepping into what does that look like and how does the trauma-informed care movement recenter itself and center that racial justice, diversity, equity, inclusion as we move the work forward in everything that we do. Let's see. The last area that we kind of focus in is in policy and investment. So implementation, education, training, community building, and then policy and investment. And as you all know, this could be at the organizational level, organizational policies that help them advance trauma-informed care, as well as listening to like, what do organizations need at the state and federal policy level? At the state and federal level, we're advising, we're doing informational testimony, we're helping to write things. We're paying attention to language, right? Language matters. And some of our policies, I don't know if you've experienced this, but policies all of a sudden end up to be like trauma informed as it's a noun. Like no, we need to fund housing and food and healthcare and basic needs, and those things need to be done in a trauma informed way. So really trying to make sure we're at those places and spaces to help share that information so that those policies come down. I don't know if you all have experienced like good practice turns to bad policy pretty quickly. So staying a part of those places so that the policy is reflective of what the people's voice is saying. And what I want to kind of finish on, because I think it's it's what I constantly think about is kind of what's working, what's been a challenge. So a couple of things I want to share. The university, the public university and the Oregon Health Authority, the public to public entity has been pretty remarkable. And I say that because we're not in competition with community-based organizations. The Oregon Health Authority knows they can only do so much as a health authority. And so the public university allows us to do things kind of quicker and differently. It also allows all of our resources to be public domain. So similar to Dave, like it's all out there. We want people to use it. We want people to kind of change it and to share and et cetera. The other thing is that we invest in the voices of the people. We invest in lived experience voice, both on staff, as well as in contractors, as well as in partnering with lots of different entities that know better than us about what a community needs. We really have a belief that trauma-informed care is and was a people's movement. And so we really want to keep that at the center. And that's been important for us because it's easy to kind of forget that at times. So really investing in those voices, staying center in our steering committee and our advising groups and et cetera. Being responsive. So for a while, it was like, what is trauma-informed care? And then it was like, how do we do it? And then it was like, ooh, how do we recenter it? And now it's like, how do we keep the people's voice? So really just being responsive to what's happening, which means pivoting deliverables sometimes, right? And pivoting where you put energy. So calling the funder and saying, hey, we're actually going to shift what we're doing right now. And we've had a lovely funder to do that with. The second thing I always feel compelled to say is like wanting to hold complexity in this work, to not get reductionist, right? There's no one way, there's no one word. There's like 30 words necessary. There's lots of different ways in doing this. And yet as things get into bureaucracy, right? Things can get reductionist really quick. Like you have to pick these 4 best practices. So we really, really do a lot of work around not having that happen, that we want, you call it whatever you want, as long as there's some centralized goals around that and thinking about that. So really honoring the messiness and honoring the time it takes to do the work. A couple other things that I think kind of we've played with and I think are, maybe are helpful to share is also, it has been critical, both as a person and my own personal ethics, as well as trauma-informed Oregon success, is to honor what's already happening. Trauma-informed care is not new. The impact of trauma is not new. There have been populations who's experienced systemic oppression forever, who've been screaming about this that we haven't paid attention to. So we really we don't go to community unless community invites us, right? We do a lot of like, hey, test us out, like ask me the hard questions, like hear who we are, look at what we have to offer, and then you decide if you want us to come in. So really starting with like, who are the elders, who are the practitioners, who are those amazing people across that have magic they've already been doing, and bring them forth. And I don't mean just like bring them forth to a meeting, like fund them, invest in them to continue that work. Elevating culturally and sustaining projects and programs. And when I say that, I mean in a way that's trauma informed. So I have a dear friend in the UK, Dr. Karen Treisman, who says all the time, modeling the model. And I appreciate, us talking about that because sometimes we fund, like when we fund things, we have a little contract that gets written up that says, you don't have to use our logo. We don't need a report. Like, how do we really shift how we actually do investment and funding? And thinking about how do we go up the chain with kind of flexible funding? What does it look like to fund the grandma on the corner who's doing the best health literacy we've ever had, right? And so using trauma-informed care and diversity, equity, inclusion to really shift that. The two things I'll kind of end with, and I'll tell you where we're headed, but I also want to say, I think one of the things that sits at the center of a lot of our work here at Trauma-Informed Oregon is that people and communities, I truly believe, know what they need to heal. It's bureaucracy that's gotten in the way of that. So we really see trauma-informed care as we don't need to tell. That's why we focus on system and organizations, right? And so how do we shift that barrier? We actually see trauma-informed care, we teach it as an engagement tool. It's an engagement tool to have people get involved in the spaces and places they need to be involved in so that they can get access to the support that they choose to and need to get access to, whether that's food or shelter or community. We also support a lot of affinity-based work with the belief that a lot of people need to heal in their own community and their own identity, and then we need to bridge that work, but allowing that to happen in a funding kind of structure. So I'm going to end on where we're headed. So a couple of things, and again, feel free to reach out and ask me more, but we're definitely we commissioned a report, and Jesse, I'm sure, can provide it on the intersections of diversity, equity, inclusion, and trauma-informed care that set forth some themes and some recommendations. So we are definitely kind of stepping that up and looking, stepping into those recommendations to see how we do that differently, which starts with like having different people's voices at these tables and at these webinars and at these places. Nourishing the networks, we just did a survey across Oregon and we heard people said they wanted to gather. So we're going to do it in a trauma-informed way, which is predictable and consistent. So every quarter, every month, there is a new gathering for people in Oregon. So if you're a champion, if you're a train the trainer, if you're a person of color training in trauma-informed care, there's a group there, somatic group, there's a group for behavioral health and a group for educators. But just having that regular, consistent place people can show up and just get support. No agenda, no productivity, right? Just get support in doing the work. We also launched a new framework a couple of weeks ago. You can read more about it again on the webpage, but we're going to be kind of stepping up resources with these 4 foundational kind of infrastructure pieces to keep trauma-informed care sustainable, which is robust training and education across the job cycle, policy and procedure review process, feedback and quality assurance, and then culture and climate. How does it see and feel to actually do trauma-informed care? We're finishing up in a fidelity model, tool. Hopefully into this week, we're going to pilot that and then it'll be out and available for folks. That's really driven from the organization. We're really interested in like peer-to-peer review and auditing versus organizational or kind of government-based auditing. We also are really stepping into somatic practice, trying to bring that back into the movement and back into the organization. So those healing practices, what does that look like at an organizational level? We're starting next week with kind of hosting just somatic practice once a month that we'll just fund that anyone can show up to virtually in our spaces. So I'll end with this, what I think is a beautiful graph. This is 400 plus people at a conference in 2019 in Oregon. And the question was, how do you want trauma-informed Oregon to look in 2030? And what I appreciate about this picture is that it was not what I thought it was going to be. It was classic like maps of the state, and there's going to be like a road, and it was heart-centered. And I think it represents what we really feel, which is also a challenge. It can be exhausting, but we really feel trauma-informed care is about all the things, right? It's about resilience, whole person care. It's about space and time for emotions, right? It's about inclusivity, lived experience, liberation. So really holding all those things while we kind of continue the work forward. So thank you.
Mandy, thank you so much. I'm hoping that you can leave the graph or the image up for just a few more minutes as I intro into the question, a quick Q&A before we have to move on. Thank you all so much. We started right on the Atlantic Ocean, ended over on the Pacific Ocean, and that's just 5 of the hundreds of communities that are involved in this work. I just want to recognize that we weren't able to highlight all of the work out there and that there is so much going on, but the 5 panelists that we had here today are exemplars for what this work can look like. I hope that everybody heard the diversity of this work, that it really does look different in communities, in different states, but that it is all impactful, and that there are those through lines. We kept hearing the need for community involvement, for voice and choice, for there to be diversity in terms of who is involved. And that shared language and understanding about how stress and adversity impact the mind, body, and spirit, the human condition and behavior, that shift from what's wrong with you to what's happened to you. So thank you all so much for being a part of this panel. Because of time, we'll end with just one question. And if each of you can take a minute or two to acknowledge, the question here, the whole purpose of the workshop is to really build up toward action, right? Building the movement. And so for folks who are looking to either start a coalition in their community or their state, or are looking to get involved, what advice would you have for those folks and those communities? If we want to go in reverse order from where we started, Mandy, if you don't mind starting. And if it's more comfortable to take the graphic down. Yeah. You are muted.
You have to ask that again really, really quickly.
How would you encourage folks to get involved in their community, building a coalition, or to get involved with an existing coalition?
Yeah, I mean, I don't think it's hard. I think you find the people doing the work, and you go, you show up. I think that's been the thing that's always been important, is that there are a lot of people doing the work, and it may not be trauma-informed care, right? It may be called lots of different words. So finding who in your, and I really here it's really worked for it to be local. So like literally who's on your street and who's in your churches and who's in your faith communities, who's in your organizations, and then slowly build that out and find out what else is going on, at the state level as well.
Thank you. Going east, Colleen, how would you encourage people to get involved?
Well, I won't repeat what Mandy has said, just ditto it. But I will say one of the lessons learned for us in running a fairly large coalition is it's really important to staff that coalition. You can't expect volunteers to do the work of setting the agenda and finding the space and taking the minutes and making sure that the co-chairs have what they need and show up and do all of that. So really invest in either in-kind staff from major contributing organizations, or hiring your own staff to do those administrative functions of the coalition.
Thank you. I can resonate with that as someone volunteered for years and is being loaned out, right? Those partnerships are so critical for any funders or big corporations on the line with us. Please look to those communities that you can partner with as well, right? It goes both ways. Jennifer, how would you encourage folks to get involved?
I think in addition to what Mandy and Colleen said, we can do the work whether we're working formally with a coalition or not. How we show up in our own families, how we show up in our own communities, the schools that we're in, our local governments, everywhere, especially right now, needs this approach. So learning how to apply the trauma lens, no matter who we're in relationship and where we're in relationship. And I would just echo that the coalition work does require investment of time and money from folks to get it done, and it has to be staffed.
Resources are so critical. There's no resource more valuable than time, but money. Everything that you were just sharing is so important. Father Paul.
Yes, I agree with everything that's been said. I would just simply reiterate, I believe that learn as much as you can about this. And I think there's, even as much as we know, there's always more research, always more information available. Learn as much as you can. And secondly, build as many relationships as you can. Relationships are key, and relationship building is intentional work. And unless we are in relationship, we will be unable to do this work in the community.
Thank you, Father Paul. And Dave, last but certainly not least.
Thank you, sir. And again, like Father Paul, ditto everything that's been said by the other four folks. There's a quote, and I love my quotes, right? From a guy named Wade Davis. Wade Davis says, the world into which you were born is just one version of reality. Other people are not failed attempts at being you, but their own unique manifestations of humanity. And when I think about this work, and I think about the impact of trauma, I keep thinking that we have to keep that in mind. We're all different. And we all just need to step in and realize that my trauma isn't yours. We don't have to compare. Let's just figure out what we're going to do with it and step into it. And again, that last piece that Jennifer put out there, or was it Mandy or Father Paul or Colleen? I don't know. We have to pay folks. I don't invite anybody, including community, into this work unless I compensate them for it. So I just want us to make sure that we're really clear on that. And just being able to make sure the community gets what it deserves. Thank you.
Thank you. Thank you all. Yes, this piece that has been the work that's been done in an unpaid fashion, it's unfair to the people who have done it, and that needs to change, but also so inspiring to see the passion that really does come out through people who have been willing to do that. And that's really what Dan's Future of the Movement was all about, right? That presentation, and it's interesting to see the parallels between the presentations and Dan's and Jane's presentation of that need to reach up to elected officials, key stakeholders, but also reach down, develop those core relationships. And that's something that we can all do. Continue to reflect on practices, continue to grow. Although the movement's been going on for a while, there is more for us to learn and always reflect back and grow and build upon. And so thank you all again for being a part of this panel. We wanted to be intentional in the designing of this workshop series to also include voices of lived experience, not that the members of the panel don't have lived experiences, we all do. But we really wanted to make space for that to be a part of the workshop series every single time after every single panel. And we are so thrilled to have Rebecca Lewis Pankratz with us today, who was supported by a coalition in her community and now works for that coalition supporting others. And you'll be so thrilled to hear about Rebecca's story. So Rebecca, thank you for your willingness to share with us today, and I turn it over to you.
Jesse, thank you. I just need to say my heart's already pumping. And so Jesse, you will kind of help me with time, because sometimes I get lost in the telling. What an incredible gift to sit and listen to all of you share the heavy lifting that you're doing and the way things are changing because of your commitments and the people that you get to be a part of doing the work with. So I will also just use some slides. Let's see if I can get it to present. I think it was my first day on Zoom. I always just kind of like to start off by just sharing that, you know, at the end of the book of Trauma Informed is this idea that we really heal a brain thing with a love thing. And so my story, I was born into poverty. Can you hear my dog? Of course, she's going to go off right now. I was born into poverty, collected 8 ACEs before the age of 18. My mom had 9. When I hit middle school, I became that kid. Principal's office, causing trouble, fights, all kinds of stuff. And when I was 15, I moved out of my parents' home and rented my first trailer house in a small hidden ghetto in my Midwest community. I was big stuff, right? 16th birthday, I called the high school secretary, told her where to go, dropped out, and was going to go out into the world and find a house like I saw those girls having on the other side of town. Right at that same time, I fell madly in love with someone that was 3 years older than me and fresh out of the penitentiary. And on my 16th birthday, we left state, and I didn't call or come home for 3.5 years. And you guys know what I found. I did not find a house like girls had on the other side of town. I found survival. My husband became a professional drug dealer, a very successful drug dealer, and I spent the next 13 years in a cycle of crime and domestic violence and addiction. I left that marriage at 29 years old. I did something my culture doesn't do. I involved the police and protection from abuse order and got out. Very quickly, I found myself homeless, no job, no car, no money, no possessions, a high school dropout. I'm pregnant with my first baby. I knew I had to do something different, so I enrolled in college full-time. I went back to work full-time, and my new baby cried full-time, right? No resources, no community, brokenness, trauma, chaos, survival. And here I am, a mommy. And I swore I was never going to put kids through what I went through. Fast forward, 2 more failed relationships, and 2 little boys later, almost a decade later, I was back in that same hidden ghetto that I started out in when I was 15. I bought a trailer house for $1,000. It should have been condemned. Holes in the floor, windows broke out, water heater didn't work, front door didn't close. Had a car that was faithful to nothing but breakdowns, 7 months clean and sober, still in college, trying to get my 4-year degree to be a high school art teacher. My oldest son and my youngest son were like climb the walls wild. Every single day I got up and I prayed as hard as I knew how to pray, and I ran as fast as I knew how to run. But this bone crushing weight of poverty and survival just keeps spinning you back, right? A lady in the trailer park said, "Hey, you got a baby. There's a place in town you can go get some diapers." "What do I got to do to get the diapers?" I said. She said, "Nothing, just go in there and ask for them." And so I started frequenting this diaper ministry at this church. And one day the lady that had that outreach, she just kind of took a shine to me. And one day I was telling her, these diapers mean a ton to me and my kids. I promise when I get through college and get my kids to a better place, I'm going to come here and give back so that other moms can have this. And she just kind of lovingly shook her head and pointed to a flyer that said something about a class to get out of poverty. And my first thought was, what are these people going to teach me about getting out of poverty that I'm not already doing? And she's like, and then my next thought was, man, I've got so many diapers from this lady, I probably better sign up. And she's like, "Oh yeah, it'll be great. You bring your kids and you go to a family style meal, and there's all these, and then the parents go to a class, and there's all these middle class people there for support." And in my mind, I'm thinking, that sounds freaking horrifying. Like, and again, what are these people going to teach me? But I showed up that first night, pretty suspicious. And, to kind of help you guys understand, my kids weren't diagnosed yet, but my oldest son and my youngest son were on the autism spectrum. I didn't go in public with my kids. And I'm thinking, I'm going to go into this place. There's going to be these middle-class people here. They're going to find out where we live. They're going to take my kids. This isn't safe. But I said a prayer, and out of the debt that I felt like I owed that secretary, I pushed open that gymnasium door that night, room full of like 60 people. And these 3, what I considered powerful looking middle-class women came over and just scooped up my little boys and acted like they weren't running amok. And then after supper, they told me and about 8 of their parents to come into a room, and they sat us down and they said, "Look, here's the deal. We see families struggling in our community, and we think the root cause of that struggle is poverty. And we want to solve it. And we need people like you who are living it to tell us what to do." So instantly they disarmed me and they empowered me. So I went back the next week, curious. And one of the first things I began to recognize is, generationally middle-class people and generationally poor people, we don't even speak the same language. You go to this 20-week class, then you graduate, there's an invitation to stay on for 2 to 5 more years to get you and your kids out of poverty permanently. I fell in love with the people in the group. I accepted that invitation. And there's a whole lot of fire and adversity involved in all of this. And these middle-class people that set the table for us to come and lead, and they supported us. Even though I had 17 incompletes at college and all this stuff going on, mental health diagnosis with my kids and school stuff, that organization and some women there helped me get those incompletes cleared up. And I was the first person in my family, immediate or extended, to ever walk the stage with a 4-year degree. And I'm trying to run off 2 screens here. And not very long after that, the organization had a job opening, and I applied, and I always ask people, I'm like, and they hired me. And I always ask people, do you know why they hired me? And they're like, well, because of this and that. I'm like, no, because nobody else applied. And so from 2012 to 2017, we got to be a part of building the largest, most successful poverty project like that in the country, getting more families completely out of poverty than any other project had ever done. And somewhere along the way, I became the diaper lady too. So I ran the outreach for the church. All these things happened in my story. As I was transforming, teachers were watching my kids transform right before their eyes. And because I'd been to teacher school, right, I knew teacher speak, and teachers just became really interested in me. So I started doing consulting on the side with school systems, found the ACEs science, found the resilient science, which ultimately resilient science is about relationships and resources. So in the science, I found my story, and I also found a way to help people understand what was happening, and more importantly, how we use the science of resilience to change lives and change our communities and change our schools. So with that, I will just say that I ended up working for an organization that is a nonprofit that trains schools. And I only accepted the job offer with them if they would let me build poverty projects as part of my role. And so since then, we've gotten 14 poverty projects off the ground in Kansas and 1 in Illinois. This slide is a little out of date. We go after data like a dog on a bone. We're working with around 400 families right now, and we get people out of poverty. The other thing that is really important to us is that our families lead, and that we have incredible middle-class relationships, and that everybody comes to the table in need and as contributors. Here's some places that we are, but I would just kind of leave with this. It's really important to us, and I heard that from some of you brilliant people that shared your work with us today. Our families lead us. They are the leaders of our work. They are the leader of their own lives, and they are the leader of their match circle when we match with middle-class relationships. We do state and local conferences, and our families are key speakers there. I also have a huge school influence, and so I bring students. And so, Jennifer, when you were talking about student-led, because I don't want to show up to a conference where the people we're talking about aren't there leading us. We are missing stuff. And then the other thing that I would just say, I just invite everyone to kind of grab onto, and maybe this is you, I don't know. There are a ton of Rebeccas running around in our communities. And now more than ever, we need human capital. And so I would just say, I am not an anomaly. I have watched human after human after human come into a community that cares about them, that empowers them, that listens to them, that provides resources to them and connections. And you watch people emerge as contributors with this lived in experience that just propels us forward so much faster. And so the last thing I would kind of say is that resilience, it's built through the I see you, I hear you, I'm with you. Conferences where we have families and kids coming to work with us coming up. And so, Jesse, I'll just kind of stop sharing with that. Am I out of time? I feel like I might be out of time.
There was a 0% chance that I was going to stop you at any point.
Well, see, I kind of wondered about that. And so I know everybody's been sitting. And so, yeah.
Rebecca, thank you. We were going into break anyway, so the time was yours. You may not be an anomaly, but you are remarkably strong and inspire other people to have hope. I know, as do all of our panelists and speakers so far. So for sharing your story, thank you. For everybody in the audience, I encourage you to reflect on how powerful it is to not just hear about the specific coalitions and the work that's done, but also those anecdotes, those stories, and how powerful that is to drive connection, even in this virtual environment that we're in. I know that I feel like I know Rebecca, though we've never met in person. And so with that, we have about a 15-minute break coming up before our afternoon session. Thank you. Well, I guess afternoon on the, from East Coast to Pacific Coast, now we're in the afternoon. So the second half of the session, at least, we've got some more great speakers. I invite everybody before we go to break to just give a quick breath, or a not so quick breath actually, because that was a lot of information. So if we just want to take a quick breath in and out, thank you for being with us. And we look forward to more in the afternoon, or in about 15 minutes again. We're going to come back at 3:40 Eastern time, 12:40 Pacific time. And for the time in between, I will just put on some calming music and share my screen quickly. To help that time go by, I invite you to step away from the computer, take care of whatever you have to do. I heard that the audio wasn't necessarily coming through so clearly, so we'll make sure to fix that for future sessions. But want to welcome everybody back.
It was a great, great idea though, and fully appreciated.
Learning and improving, much
Yes,
like we were talking about in that first half.
exactly. I think I got my mouse issue. It's fixed. It developed a mind all its own. Good. I would like to know also from Whitney how to do that. Oh, Lana could hear the music.
Glad that you could hear it.
Yeah, I could hear it. It just was glitchy and scratchy and stuff.
Not doing the beautiful music justice.
Yeah, I
We'll
mean,
fix that for future sessions.
it might depend to some extent on people's connectivity as well.
Mhm.
Mine's usually not too bad, so I don't know.
We're at that 3:40 time if
Yep. Yep, yep, yep. Okay. I am ready if you are. Are all the presenters back?
Kelly and Leslie, yep.
Okay, Leslie, excellent. Let's see, is Kimberly? Will Kim be coming on?
Yes, I'm here, Denny.
Oh, you are.
Mhm.
Sure. You're down at the bottom there. Okay. Alrighty. So we should start. If everybody is ready. I'm just going to circle back a little bit at this point in the agenda, now that we've had a relaxing break. Hopefully everybody is feeling refreshed and reconstituted, although still very energized from the previous sessions, which I really think have increased the momentum even more so. Just as a very brief recap, I have to say it's almost impossible to do justice to the presentations that we just had, because there was so much richness and so much instructiveness for each one of them. But I will just say that the reverberating themes that I discovered across all of the presentations was the need to apply an equity, social, and racial justice lens with all that we do when working in this space. Another theme that came across was the need for cooperation across systems and other sectors of our society, cross agency, cross community, and so forth is absolutely key to being a successful movement. And that we also need to prevent trauma exposure, not just rely on reactive approaches. Yes, we do need to mitigate the impacts of exposure after the fact, but let's do what we can, as these speakers has shown is possible, to reduce exposure in the first place. Some of the key takeaways in my mind have been to take the focus off of individuals. I've been working in the field for longer than I care to share with you, but in research, we've often relied on deficits models, and we're getting away from that. entirely. We're looking more at the external forces and the structural drivers that give rise to trauma and its impacts. And I saw somebody in the chat earlier say, it's what happened to you, not what is wrong with you. And that's what we need to take into account across the board, from our research to our practice and our policies. Also, we want to raise up community voices. We don't want to impose our belief systems, our research, our values, or our cultures or customs on communities. So we need to be very careful to lift up the community voice in this, not be an imposition, and ask communities, what do you need? What do you want to do? How do you want to play a role in this movement? We also want to make room for flexibility, adaptation, and customization at the community level. And so that everything has to be driven by the community. It has to bubble up from the community. Otherwise, any changes that we make will not be sustainable, and they will not be embraced by those that seek to benefit the most. We also want to provide the tools, and that's the whole purpose of this workshop series. Mandy talked about engagement tools, absolutely essential. We want to provide the whole array of tools that's necessary for communities to become increasingly relevant and influential with their decision makers. And then my final notation is that we also, in addition to focusing on structural drivers and external forces and so forth, we actually also have to focus on abuses that are often experienced within our systems that are supposed to be child-serving systems, you know, our pediatric systems, our educational systems, child welfare, juvenile justice. Oftentimes abuses are really actually reinforced, and there's re-traumatization within these systems. So now is really the time for this movement to take place. It, as Dan pointed out, it's been increasing in momentum already, but because of this tragic, devastating pandemic, it's really made people more aware of the need for public health and prevention approaches, and the need for a new shared vision that we're seeing across a lot of demographics, not all demographics. So we have much work to do, but we want to be able to tackle the disparities and the inequities and the injustices that have actually led to the disparate impacts of the pandemic. There are so many organizations that are involved in this process, and we want to pull everybody together so that we can do this collectively for collective impact and for sustainable uptake, implementation, engagement. So with that, I'm going to go to our first speaker. So I'm so happy to be able to introduce Kelly Graves. She's become my best friend in about 3 months. But she is amazing. So she's the co-founder and executive director of the Kellen Foundation. She's a licensed clinical psychologist in North Carolina. After serving as a tenured associate professor for 16 years, she decided to pursue her passion of bridging research and practice by building science-based and community-based behavioral health center. Since then, the Kellen Foundation has been named a partner with the National Child Traumatic Stress Network. She co-developed the Greensboro Child Response Initiative, a nationally recognized model by the U.S. Department of Justice. And she's received numerous awards, including the American Psychological Association Division 56 Award and the Triad Business Journal Top 40 Leaders Under 40 Award. So Kelly, the stage is yours.
All right, hopefully everyone can see the screen. I am so honored and humbled and excited to be a part of this series today and the ongoing series that will be over the next several months. Such rich information that we learned in the sessions earlier. And I'm hopeful that this particular session will help build on that. And so as we're hearing, the momentum is continuing to build. And that's the case in North Carolina as well. So what I'm going to share is just kind of our state's story, as well as states from across the country, things that we've learned in a report and an initiative that we have worked on and are continuing to work on called Resilient NC. Our particular focus in this initiative is really looking at the community resilience level. So I know I'm preaching to the choir here, but just to kind of level set, we know resilience is built. We know community level resilience is different than individual and family level resilience. It's more systems focused. It's more community engaged and community driven. And one of the things that we have heard is that there are some places across the country that think sometimes as that you're working on either trauma or resilience. And what we're particularly pushing in this report and in our conceptualization is it really is a both and. We can prevent and address trauma and build resilience simultaneously. We can do those things in concert. And in fact, the science tells us that when we do those things in concert, we're the most effective in helping to support communities and support their thriving. So again, the momentum is continuing to grow. The pandemic has laid back pulled back the layers of how much this type of work is needed across our country and across the world. And as we were hearing, there are so many different strategies that are used that are all fabulous strategies. But what we wanted to understand is how do we take individual strategies, spokes on a wheel per se, and have them work in concert and in combination so that we can have a bigger impact collectively with a multi-pronged strategy in our approach. So to do that, we worked in partnership with support from the Weiner Family Foundation and with partners across North Carolina and across the country to do a Resilient NC overview. So we talked to places across North Carolina that were doing resiliency-based work, local coalitions, statewide agencies, et cetera. And we also talked to state leaders across the country about how they have rolled out their statewide initiative. What strategies have they found to be really helpful? Where did they hit roadblocks, lessons learned, that kind of thing. And the goal was to take this information, to not reinvent the wheel, but to use learnings from other initiatives and states across the country to develop a set of recommendations for potential implementation for our state on building resilience across our state. And so I'm going to give you a really high level overview. The report is very detailed and has a lot of information. So I'm really just going to hit some high notes here. And I'll put at the end of my presentation, I'll put the links in the chat box for how you can get directly to that report and to the subsets within that report. But it's broken down and hyperlinked intentionally because having come from academia and having done a lot of research, I always like to have anything that I've written be useful, not something that sits on a shelf. So our report is very interactive. All of the pieces that we reference in the report are hyperlinked so that you can get to each of the different tools and information that might be helpful. And there's also some at-a-glance glossaries to cross-reference some of the recommendations and strategies that have been helpful across the country. So just high-level overview, these are some of the initiatives we spoke to across North Carolina. Some of these you may know in the work that you're doing, including Prevent Child Abuse North Carolina and the North Carolina Partnership for Children. And a lot of the key players across our country, across our state, doing resilience related work. And then of course, we talked to many, many states. The states in with California down are states that we did deeper dives with, where we did interviews and document reviews and summaries. And then we also heard from these states, additional states that we would want to talk to. So Alaska on down, they're referenced in the report as well. Although we weren't able for time and resource sake to do deeper dives into those states, but they're all referenced in there in the report as well. So from talking to all of these state leaders and individuals across North Carolina, we came up with an 8-pronged strategy to building a statewide resilience initiative. And so what I'm going to do is just kind of hit those strategy high points to provide some insight and recommendation for what we learned and what we heard from local communities, statewide groups, and initiatives across our country. The first is that backbone support is critical. What we heard throughout the interviews and the conversations is that states that demonstrated the most success tended to have a backbone agency in their state that helped to drive and coordinate the work. Not an agency that did all the work, but really played as that convening group to coordinate different pieces, to coordinate cross-sector work, to link coalitions to each other, et cetera, et cetera. So that backbone support in a state was indicated to be particularly important. There's pros and cons to how backbones are structured. Some states have backbone structures that are based within state government entities. Some states have their backbone based in a nonprofit. And so there's a lot of examples of how different states have established a backbone, and there's pros and cons to each those that are outlined in the report. But the general takeaway is that having that backbone support was a critical mechanism to really get the momentum and the movement across that state moving forward quickly. The second recommendation is really thinking about your public awareness and strategic communication strategy. What we were finding in our state, and I'm guessing you may see in your state, is that depending upon where you are, you'll get different messaging and different ways to conceptualize different types of information about trauma and resilience. And while that's helpful, and while it should be coordinated with local communities, there's some key messaging that would be helpful to be pushed throughout a state and throughout the country, much like the ACEs, the number story campaign is happening across the country. So thinking about how do we centralize information and push some of the same messaging out across the state for stronger communication, thinking about other platforms that like social media platforms and YouTube channels and different ways that individuals might link into information other than emails, right? And other than a website. How do we think about getting creative with how we reach communities? Another piece that came up throughout our review is the importance of potentially developing a centralized website. Some of the websites I've seen in the chat box already that states have kind of a statewide website that helps to host some of the information, the strategic communication, the resources, the training opportunities, et cetera. That seemed to be a good convening piece for states that had that across the country. So we're looking at doing that in North Carolina and thinking about whether that would be helpful for our state. The third recommendation that was lifted up is really the importance of building those public-private partnerships, thinking about how do we engage not only local community members, but also elected officials, business leaders, and identifying those resilience champions that may be connected to the business community and the philanthropic community that can help us to support the work. Thinking about how do we create funding structures on the front end to support the work, I think Dave Ellis said earlier, the importance of making sure that as we're building the momentum, that the individuals in the community and the people working on the strategies are compensated for their time as well. And so this public-private partnership was a key recommendation that we heard across the country as critical to really moving the momentum forward. And there are a couple states that have really strong examples of how this has happened, including California with their resilience effect with Gentech that you'll be hearing from later in the workshop series, and some other states that are outlined in the report on how they built their public-private partnerships. The fourth recommendation was continuing to build the training and technical assistance. I heard a speaker say earlier that training is essential, but not the only component that's needed. And that's really the idea around this 8-pronged strategy is training is critical, but we also need these other strategies as well. So training was one of the strategies that was lifted up, continuing to think about how do we share more information about ACEs across sectors, not just in the common circles that we may engage in, but across sectors and across communities, thinking about developing a statewide training plan. We are learning more and more about how we can reach communities virtually and using some of those tools to potentially expand our reach as well. And a theme that we heard throughout is the desire to support the people doing the work. We heard a lot about secondary stress and burnout and thinking about how do we help support the helpers, like helping the helpers kind of piece as a key component of a training and technical assistance plan. Strategy number 5 is cross-sector partnerships, where we looked specifically, and it was highly recommended to think about how we integrate schools and juvenile justice and communities and churches and all the different components of the system of care model. How do we bring those components together to do cross-sector work? What we were finding across North Carolina and across the country is there's multiple coalitions and collaborations that sometimes are in the same community and they're doing very similar work, right? So how do we think about strategically engaging in partnerships both at the local level as well as across the state to build that momentum in a more strategic and streamlined way? The sixth strategy is policy and advocacy. So one of the key spokes of the impact wheel is this policy and advocacy piece, continuing to promote the adoption of trauma-informed care policies at the local level and state level and federal level. CTIPP has been, one of the driving forces behind this and has really given some great tools to share with local communities on how they can engage their local elected officials as well as their state elected officials. And so, for example, a state website hub could be another way that this information can get pushed across the state. If there's a centralized state website where people could access across that state. And it can also link to CTIPP and to other policy and advocacy groups within that state. Pennsylvania and California in particular have done some really strong work in policy and advocacy, and several other states are highlighted in the report. And many of the partners that we talked to in the interview process also were willing to share samples of executive orders that they drafted and different policies and proclamations and things like that. So all of those are available and able to be shared from other state partners. So we don't have to reinvent the wheel. We hear all the time about local coalitions and other entities working really hard on different drafts of proclamations and things like that. While that's great, they may not have to start from scratch. There are templates and things available if we better coordinate to provide some guidance in that arena. The seventh recommendation is supporting local coalitions. And really this is a major driver of this whole conference series, is really looking at how do we develop funding streams to support the local coalitions that are doing this work on the ground, and how essential that is. In states that had this support, the coalitions were more impactful, more broad, and more sustainable, and had less turnover. And so thinking about how do we build mechanisms that support those local coalitions, and build mechanisms so that local coalitions across the state can learn from each other, whether you're just starting off a local coalition or you've been doing it for 10 years, really mapping up an opportunity to learn from each other in a learning collaborative model. So that was the seventh recommendation. And last but not least, the eighth recommendation was developing and thinking on the forefront opportunities for shared measurement. Thinking about how do we measure the impact that we're having, right? Because we all know that as we can show the impact, the funding streams tend to follow in terms of where are we making the most impact? How can we ask for more support by showing the data and the impact that we're making? And so thinking about creating some measurement toolkits, which might be a compendium of different measures, resiliency related measures, community resilient related measures, hope measures, those kinds of things that communities can access and states can access with a click of a button to see different types of ways that communities are measuring resilience and measuring their impact across their community. And again, kind of thinking about how do we create this in a more centralized way so that 25 different coalitions aren't trying to search for how to do this. And we have kind of a compendium where people can go to and see, oh, here are some ways that communities have done this across the country. There's some partners in North Carolina, including Cape Fear Collective and some other partners that are doing a lot of this great work and referenced in the report as well. So in terms of what's next, I know my time is just about out, but we're working to continue to disseminate to a variety of partners and audiences and getting feedback and learning from people that we're sharing the report with, what resonates and what doesn't, and continuing to build out action teams that can help us refine these strategies and put some action steps into them. With the goal of rolling out an action plan by the end of this year and early 2023 to implement the different strategies. As we think about this work, particularly on the national scene, I think this is applicable. This report is really helpful and applicable to people across the country because it's not just specific to North Carolina, even though it says Resilient North Carolina. The whole second section of the report is really focused on profiles of different states from the different states. You know, they all reviewed and provide feedback to indicate its accuracy and completeness about how states have rolled out their initiative, what they learned, what worked, what didn't, et cetera. So I think that information can be particularly helpful for people across the state, across the country, whether you're in North Carolina or not. And I am out of time, so I will put the the reference to the report so that you can get the downloadable pieces of the report at your leisure. And thank you so much for the opportunity to share this with you.
Carrie beat you to it.
Okay.
The link is already in the chat. And thank you
Great.
so much, Kelly, for that spectacular presentation. I was just bowled over by all the work that your organization has done in the state of North Carolina. So it's very, very impressive and exciting. Okay, I am now going to introduce Leslie Lieberman. Welcome. She has spent her professional life working at the crossroads of public health and social work, bringing together and fostering relationships amongst diverse groups who collectively address pressing social justice issues, health and social justice, excuse me. Leslie is the Senior Director of Training and Organizational Development at the Health Federation of Philadelphia, where she leads a multidisciplinary department which builds organizational, system, and community capacity for trauma-informed care, HIV/AIDS care, resilience, and healing. In 2017, Leslie was recognized as a Sesame Street Sesame Hero for her long-term commitment to improving the lives of young children.
Thank you, Denny. And thank you everyone for hanging in this afternoon. It's late on a Friday afternoon, snowy in Philadelphia, but I'm so glad you're here and I'm so delighted to be here. I want to extend my thanks to CTIPP, to NPSC, to PACES Connection, and all the other co-sponsors for inviting me to be part of this amazing workshop and for organizing this fantastic series. So I was invited here today to speak about lessons learned from my work coordinating mobilizing action for resilient communities, MARC for short, and I'll get to that momentarily. But as so many people have said, this work begins with self. So I want to share a little bit about my journey and why I so passionately believe in the power of community networks. Now, some of you may know that I am a fan of the social justice activist Margaret Wheatley, who said, "Whatever the problem, community is the answer." And these words really do resonate for me because both professionally and personally, I've had the opportunity to experience and witness the power of communities, their power to connect people, to help them heal, and to inspire them to confront and improve the conditions that challenge them. One of these experiences has been my work with community-based public health coalitions or networks, which actually began more than 30 years ago when I was a young social work intern in the Contra Costa County Health Department in California. And when I was there, I staffed several coalitions that were aimed at preventing specific health issues, such as smoking and childhood injury. And it was there that I really learned about the power of bringing people with shared concerns together and leveraging their collective vision to create positive changes. Fast forward about 20 years later, when I was formally introduced to the science of ACEs and all the ACE attributable poor health outcomes, the concept of trauma-informed practice and resilience. And then add another 5 years to that when I became a founding member of a local network, the Philadelphia ACE Task Force, that I began to really understand the even greater power these public health coalitions or networks could have when rather than being focused on a single issue, they were organized around the science of ACEs, trauma, and resilience. For shorthand at MARC, we've come to refer to these groups as ATR networks or ATRs, and I'll be using that acronym during the rest of my talk. Now, very recently, I came across another Margaret Wheatley quote that struck me as an even more accurate description of what I've learned about what makes ATRs in particular such powerful and potential levers of change. So my new favorite Margaret Wheatley quote is this one: "There is no power for change greater than a community discovering what it cares about." And I think my tagline for that would be, and there is no power for a community discovering what it cares about greater than an ATR network. So why is that? Well, for the last 6 years, my colleagues and I have been learning about and from 18 ATR networks through our role as the coordinating organization for MARC. In that role, we facilitated a multi-year learning collaborative of 14 ATR networks. And I've heard a number of people put in the chat, we need a community of practice, and that's what we had. It was an incredibly rich and powerful experience. And we had support from the Robert Wood Johnson Foundation and the California Endowment to do that. And we also engaged in a very robust cross-site evaluation that was conducted by a research company called Westat. Also, as part of our MARC work, we recently conducted a survey of ATR networks with the National Opinion Research Center at the University of Chicago, better known as NORC. And in this study, we heard from hundreds of ATR networks across the country about their key characteristics, their accomplishments, their current goals, and technical assistance needs. And I'll talk a little bit about that study today, but if you want to hear more and it piques your interest tune in to our webinar about the survey, which is on Friday, January 31st. Unfortunately, does not conflict with this series. So together, the deep dive from our evaluation and the snapshot from our survey have provided a proof of concept for us, demonstrating that ATR networks can help us better align, accelerate, and augment the community-driven solutions to ACE attributable poor outcomes that are already happening throughout the US. And I think a number of speakers have already talked about that communities have the solutions. What ATR networks are is a vehicle for really operationalizing those solutions. So it's not just about strong collaborative action. It's about a group with diverse experiences, perspectives, expertise, skills, and agendas coming together, realizing their commonalities through the science of ACEs, trauma and resilience, embodying the trauma-informed approach, centering prevention and healing, and operating accordingly. Operationally, this often means that ATR networks enable groups or people or groups who may have come with a single issue agenda to shift their focus and embrace the connections among them. A great example of this is a shift in the evolution of the Southern Kenai Peninsula Resilience Coalition from a group that was addressing substance abuse and domestic violence to one focused on the underlying issues of trauma as well as intervention and prevention. Now, several of today's speakers have referenced ACE initiatives or coalitions. Basically, for us, these are analogous to what we call ATR networks. And for us, there are a few defining characteristics that give ATRs their possibility and power for creating change. From our experience, these groups are successful when they represent a geographic community that's large enough to affect policy change at the legislative level. Many include that defining characteristic in their name, such as Peace for Tarpon, a small town network, Philadelphia ACE Task Force, a large city network, the Illinois ACE Response Collaborative, which is a state network, and Southern Oregon Success, which is a regional network. A second characteristic is that they're cross-sector, and several people have talked about that already. In our recent survey, networks reported participation from 32 of all of the from all 32 of the different sectors that we asked them about. Now, almost all of them reported engaging the partners you might expect in this work. 90% said they had representatives from social services, health, and education. But nearly 80% also reported having community members engaged. Nearly 60% had members from faith-based organizations in the housing sector, and nearly 40% had members from law enforcement, philanthropy, and business. Altogether, that's covering a lot of bases. And as you can imagine, this diverse representation is one of the elements that makes these networks so effective. While we didn't specifically ask about whether or not these networks included people who had been personally impacted by trauma and ACEs, we know this is imperative, and several people, especially Rebecca, have spoken very poignantly about that. And we believe it's most likely when there is a broad range of representatives in an ATR, especially when it includes community members. In November, Representative Ayanna Pressley said, "The people closest to the pain should be those closest to the power," in her remarks about trauma-informed policymaking. ATRs can and must be a vehicle for this. Another critical component of effective ATRs is that they clearly center ACEs, trauma, and resilience as their organizing principle. And evidence of this is often found in written materials about the ATR or in their mission or value statement. And in fact, here's an example of that from an ATR that our previous speakers involved in. Not only does it clearly articulate that the group has a focus on ACEs, trauma, and resilience, it identifies the geographic reach, and it suggests that the network is cross-sector. And finally, our last defining characteristic for being an ATR is that the network meets in person. Now, we know over the last 2 years, we've all learned that a ton of really good work can be done virtually. And we actually saw that value of the virtual connections for our ATRs even prior to the pandemic, because our National MARC Learning Collaborative met virtually most of the time. Nonetheless, there is absolutely no substitution for the magic that happens when people are in the room together. It is the most efficient and effective way to build connections and trust. This was clearly demonstrated when we visited each of our 14 sites and then attended their in-person ATR meetings. And this is a photograph from our visit to Alaska. And when we brought our learning collaboratives together for in-person convening. So I think that I probably share a hope that in 2022, we'll all be able to restore and resume this critical component of movement building. Our experience in MARC also has taught us a lot about how ATRs function, what they do, and what impact they can have. We created this model of key network functions based on our work alongside network leaders. I'm not going to go through each of these today because all of these functions were beautifully illustrated in the presentations that our panelists just gave of how their networks do the work, the incredible work that they're doing. Sorry, I skipped there we go. We also in our survey asked ATR networks about what kinds of activities they engage in. And you heard a lot about that also from our panelists. Since you can see from the survey on this slide, the range is broad and diverse, which is a good thing because many touch points are required to affect the change needed to create the healing and resilient communities we all envision. But what about impact? So far, I've been speaking about ATR network process, but we've also learned lessons about their outcomes. Our evaluator, Westat, used several tools to measure change over the 2-year period of our MARC Learning Collaborative. One of these tools was a social network analysis that measured growth in depth and breadth of connections among network members. So this slide illustrates that growth in one of our networks in the Learning Collaborative, and there were similar results across the whole collaborative. Now, some people might say, growth isn't an outcome, but my colleague Claire Reedy, who's done a lot of work with community organizers, reminds me that in organizing, growth is an essential outcome because more people equals more power. Growth is how we mobilize for action. Westat also measured change using a methodology called outcome harvesting to explore networks' contributions to change at various levels. And Westat identified outcomes across the 14 sites in 6 areas: adoption of trauma-informed practices, that was the largest bucket, relationships, funding, and data, organizational policy, and even public policy. And at HFP, my organization, we were particularly gratified to see these outcomes in the public policy arena, as one of our goals was to encourage our ATRs in the Learning Collaborative to engage in policy work, and it happened over a relatively short period of time. This slide illustrates how the Alaska Resilience Initiative, ARI, contributed to a House resolution, which eventually became a very important trauma-informed policy, Senate Bill 105, which had very strong language about ACEs trauma and resilience in it. Our NORC survey, however, did suggest that there's still a lot of work to be done to help ATRs do policy work. Only 1/3 of the networks surveyed reported that they currently engage in policy and advocacy activities, and even fewer, 16%, identified policy and systems change as a top goal for their network. The good news, as we see it, is there's lots of opportunity for growth here, something that CTIPP and others speaking today are really well positioned to do. Our contribution to building ATR capacity for policy work is our MARC Policy Toolkit, which was created especially for ATR networks. The toolkit demystifies the process of how ATRs can effectively lead, facilitate, and participate in policy work. And we include a broadened definition of what constitutes trauma-informed policies, as well as many, many ways that ATRs can engage in policy change work. So you can find our policy toolkit along with a rich and carefully curated set of resources on the MARC website. It has hundreds of stories in multiple formats by and about networks, along with a searchable database, very much like what Kelly was asking for, where you can put in terms that can be helpful to the particular needs for your network. For example, you might be a city-based ATR looking to engage more community members or interested in how ATRs are working with law enforcement. You can put in those search terms and come up with a set of resources and stories about how others have done that kind of work. So we hope you'll check that out. I want to say 2 things in closing. First, here's my call to action, which really echoes much of what Dan and others have said. If you are already part of an ATR network, thank you. I hope that what I've shared today will inspire you to grow and find new ways your ATR can create change in your community. If you aren't part of an ATR, find one in your community and join it. There are maps both on the PACES Connection, website, as well as on ours of local communities all over the country that have ATRs near you. And if you can't find an ATR near you, start one. We and everyone on this panel today is here to help. Lastly, you know I like quotes. I will end with one from another powerful woman, maybe one that you've heard before, but it deeply resonates for me and inspires me to continue to do this important work. Thank you.
Outstanding, outstanding, Leslie. That was so good. So many lessons learned, but tools, actual tools to use and ways to create these kinds of coalitions and communities. So that was just such a rich presentation. Thank you. I'm now going to introduce Kim Rogers, who's going to pull it all together. Kim Rogers is the Program and Communications Manager at the Center for Community Resilience at the Milken Institute School of Public Health. With passion for equity and justice, she oversees the Building Community Resilience Program, providing capacity building and technical assistance to multi-sector networks and stakeholders working to create healthy, resilient communities by addressing trauma and fostering equity. Prior to joining the center, Kim spent 5 years as the communications manager at the National Association of County and City Health Officials, supporting local public health practice by promoting programs, tools, and resources, and trainings developed by and for local health departments across a range of topics. Take it away, Kim.
Thanks, Diana. Hi, everybody. So, you know, for the last few hours, you've heard some really concrete and inspiring examples of why coalitions matter, what it takes to build and sustain them, and what's possible when we bridge together our expertise, our resources, and our experiences to change the status quo. And unfortunately, I wasn't able to join till around 3:15. So hopefully me pulling it all together is really like reinforcing what everybody shared today and not overly repetitive. But for the next half hour, I'm going to talk to you a bit about how we approach coalition work at the Center for Community Resilience and how a pivotal moment in our Building Community Resilience Collaborative transformed the work that we do today. So a little bit of background, our center provides technical assistance, facilitation, research, and policy guidance to help institutions, organizations, and collaboratives address the root causes of childhood trauma, foster equity, and build community resilience. And you know, led by Dr. Wendy Ellis, our work is really grounded in preventing and mitigating adverse childhood experiences that happen in the context of adverse community environments, which I'm sure you're all familiar with, the pair of ACEs. In 2015 is when the Building Community Resilience Collaborative, which I'll refer to as BCR moving forward, launched. And we launched in 5 states across the country. And you'll notice it may be a little bit hard to see, but most of our partners at the time were in the healthcare sector. And that's because our goal was really focused on increasing the capacity and the coordination of health, behavioral health, and social services. But in the last 6 years, BCR really has evolved into a national network of regional and statewide coalitions that are now coordinating across sectors for trauma-informed and resilience-based transformation to policies, programs, and practices. And this has really been possible because our process of continuous quality improvement has equipped our partners to advance beyond that thinking of individual level interventions for trauma-informed practice and really graduating to be able to collaborate across sectors for systems level change that's really fostering and focusing on equity as a primary prevention mechanism for trauma. So what you see here is our approach, which we call the BCR process. And it was born out of the lessons that we learned in the early years of the BCR collaborative. And, you know, again, this process is iterative and it's nonlinear, which really allows for it to be adapted and implemented in whatever way is most useful to whatever group or organization is really coming together in service to transformative change. And so as you see on the screen, there's 4 key components: creating shared understanding, of community adversity, assessing the state of readiness for change, developing cross-sector partnerships, and engaging the community in a collaborative response to prevent and address the adverse conditions that create trauma. And so I'm very certain that each of these concepts has come up to some degree throughout the day. So I really just want to quickly run down the bottom line of each and how we sort of implement at CCR. So we think about creating shared understanding. The beauty of a coalition is that it allows for the bridging of different people and organizations who are all contributing, their own expertise and relationships and resources to whatever the mission is. But with that also comes this reality that everyone is also bringing their own perceptions of and solutions for the issues that the coalition wants to address. And so creating shared understanding is really about establishing some consensus around what's making it difficult for your community to thrive, so that everyone has a similar scope of the challenges when it's time to come together to co-create solutions. And, the ways that we have done this over the years are through monthly learning sessions and in-person convening. So really that high touch connection between the members of our broader collaborative and the coalitions within, and then also through in-person meetings, but those have, obviously with the pandemic, we haven't been able to meet in person in quite a while. So the next one, assessing the state of readiness, really comes down to the deep systems transformation that's required to get sectors to adopt a trauma-informed lens really takes time. And we also know that sweeping change isn't going to happen all at once. And so even in a coalition where there's shared goals, the capacity and the capabilities for trauma and for implementing and working for trauma-informed care are going to differ across stakeholders. And so by assessing the state of readiness, and that's in relation to your coalition, to your external community stakeholders, and of the community more broadly, really helps you to better negotiate how to prioritize your coalition's time, attention, and resources. And, more than that, by analyzing the landscape that you're working within and really getting a deep sense of it, and that includes the political, social, and cultural dynamics, you really can gain insight into where there's potential for traction and where you can anticipate an uphill battle, which helps you to make, again, more effective decisions about how to strategize, message, resource, and act for change. I do want to note that over time, while what I just talked about was very focused on assessing sort of system readiness, there also has to be a degree of assessment in terms of individual and organizational readiness for this kind of work. And this becomes especially important as more folks begin to bring equity and justice from the margins of the work into the center. And I'm going to come back to that a little bit later. So everybody on this call knows cross-sector relationships and partnerships are important because we know that community trauma is intersectional and compounding. And so, what's happening in healthcare is related to what's happening in schools, is related to what's happening in housing, and so on. And so we know that every system holds a piece of the puzzle, which is why this movement toward trauma-informed communities really calls for all hands on deck. Partnering across sectors allows us to widen the scope of data and stories of our resources, our social capital, and our community linkages that are available to us. And all of those things are really critical to building collective will for trauma-informed policy and practice change. And one thing I do want to share is something that we've learned is that, the quote, right partner isn't always the obvious one, right? So there's a role for arts and culture. There's a role for museums and libraries. There's a role for local businesses. So I think sometimes in traditional, we work in my organization is situated in an academic institution. And so in that kind of traditional sort of structure, I think it's easy to think about who we would typically engage with for work like this. But in reality, everybody has something to bring to the table. And then, of course, community is at the center of our collaborative's work. And I'm not going to spend a lot of time on this because you all know very well that the deepest understanding of trauma exists in the people who've experienced it. And, lived experience is where the stories, the lessons, the ideas are, and giving space to that is really vital to our work. And so now that you have, I just want to pause to check the chat real quick. Okay. Now that you have a sense of our BCR process and how we approach this work, I I want to share from the perspectives and words of some of the people who have been involved in the BCR collaborative, some of the things that they've picked up that really sort of drive and contribute to our values as a center and BCR's values as a collaborative. So I've got a few videos that I'm going to share, and they're very short. And I'm going to present them without comment because I think what is shared in the video is like clear cut and concrete, and it really cuts at these really important aspects of the work that we do.
Thing I've always kind of told myself is that the power is already there with the people. We have created policy, practices, and procedures and institutions that have stripped away their power. I mean, made them believe they were powerless and therefore they're hopeless.
So I lied. I will present comment, which is really just to reinforce what I feel like are the most important pieces of each of these videos. And what I loved about what Chris said.
But you can't have the conversation you want to have until there's some level of trust. And that begins with listening. And someone trusting that, oh, when I talk, they're listening and they're willing to even hear criticisms of what they do or who their organization is or what it's been up to.
And so this is one of our staff at CCR who has now left, but what Harrison said here is, you can't have the conversation you want to have until there's some level of trust. And we know that that's super critical.
Co-creation allows us as a convening organization to make sure that we're leveraging the thought processes and also best ideas of those organizations that we're partnered with. And then it also allows us that as we create solutions that we're all a part of the solutions.
We're all a part of the solutions.
Had to humble myself and check myself as a Black woman and just say, okay, I'm showing up all wrong. First of all, I'm not saving anybody. I'm not working for anyone. I'm working with. These are the experts, and I'm actually here to learn before we can move forward with solutions.
So that was the last one. And this one I think is so important to the work that we do, because I think all of us who are here on this call are here because we want to see transformative change in our communities. And we want people to be thriving, to feel healed, to feel whole. And I think in some ways we can fall into a trap of feeling like we have to save the people that we're working with or that we're working for. And I think the first video that I showed, really demonstrates there's already power in the community, right? We're not necessarily, and we even talk about like the language of empowering and what it looks like to say that, we're empowering a community. There's already power that's there. So we really think of it more as like, how are we amplifying what already exists and what strengths are already there in community? So there's one more important lesson that we learned, and it ironically almost brought the coalition to a halt. And so in 2018, we introduced equity, and particularly racial equity, as a pathway as the pathway from community trauma to community resilience. And after doing this work for several years and seeing how much progress still had to be made in communities of color, we really felt strongly that you can't be trauma informed if your practice doesn't address racial trauma and commit to fostering racial equity. And, this shift in thinking was sparked by a couple ideas. So, from my perspective, I was thinking about trauma as, in some ways, the absence of something, right? Of safety, of love, of basic resources, for example. And that's a result of inequity. And so if we're not working to create equity, we're not working to give people the supports that they need, people and families the supports that they need to be whole. And then secondly, there's this understanding that if we can make progress toward racial equity, in the context of America and all that goes into our history, then we'll be well positioned to really work for equity across other social positions. And they're also not mutually exclusive, right? And when we brought this to the table, the reaction from our coalition partners was really mixed. There were some who felt that centering equity in the work might be a distraction, and a few who thought about walking away. And when we reflected on how we went, or like how we went wrong, maybe in the way that we presented it, we realized that we had made some sort of miscalculations in our process. And you know, going back to state of readiness, our assessment of the coalition's state of readiness was frankly off. You know, we'd been working arm in arm with these partners who were really strongly committed to preventing ACEs for 3 years. And we assumed that everyone would be able to see how racial trauma is an enduring source of adversity for the children of color in their community. But you know, knowing racial trauma exists and it's something that needs to be worked on, and finding your actual role and action in confronting it are two very different things. And so on an individual level within the coalition, there was a lot of variation in people's capacity and capability for acknowledging, grappling with, and then acting against structural racism. Some people felt out of their depth. And so, you know, what happens when that happens? There's a fear, right, of entering into that unknown territory. And before I go on, you know, please know this is not an indictment of those folks, right? We've been collectively socialized to have this natural avoidant response to conversations about race, especially when those conversations require us to get like radically honest about it. So there's really no shame in that reaction, and I don't want anybody to have that sense. But the reality is, at the same time, is that if at an individual level, you can't sit with the discomfort of talking about racial trauma, it's not going to get brought up in a group setting, because that discomfort only gets amplified in the presence of others. So, you know, what did we have to do? We went back to our process and thought about how we could foster and integrate a new shared understanding within the collaborative about equity. And that shared understanding really now drives the work that our sites are doing. That came, and I'll be happy to share this in sort of the post resource notes, but we developed an entire guide on fostering equity in communities. And it gives a policy perspective. It gives a sort of self-assessment. What do I need to do to ready myself personally? It gives some guidance and some tips and some lessons around how do you authentically engage a community? What does it mean to be engaged with community? And then it brings back in policy again. So when I said policy, for the first section of it, that's more of a history of policy in America that has led to today's inequity. And the policy chapter at the end really gives concrete tools for like, how do you put equity into policy? And so, you know, these are the kind of ways that we and tools that we built to help create that shared understanding. And the result is that today, every regional coalition in our collaborative is working on racial equity in some form or another. And again, you know, we laugh about it today when we talk about it, but we really thought that the collaborative was dead in the water. And I have to point out that the reason that we managed to keep people at the table was because we had trust, right? We've been working together for 1, 2, 3 years. And the ability to see through those initial reactions and to hold space for each other through those initial reactions was really important to us getting to where we are today. And that trust has continued to grow to a point where our coalitions feel comfortable collaborating and are doing collaborations with other local partners outside of the BCR network for racial equity. And so, you know, one of these ways is in October 2020, we launched a Truth and Reconciliation process with our Cincinnati BCR network. The national uprising that happened in the summer of 2020 in response to, you know, continued police violence against Black bodies really created this opportunity for us to mobilize our coalitions around racial equity as integral to community resilience. So they had been thinking about and chewing on and processing equity for 2 years. And then there was this, you know, the group was called to do something. And so again, with members of our Cincinnati BCR network, we convened a cross-sector coalition of organizations that were in healthcare, arts and culture, early childhood ed, and K through 12, academia, and philanthropy. And again, since October 2020, we've been collaborating to create opportunities for sort of shared learning around the region's history of racial oppression, and for facilitate chances for the community to come together to foster racial healing. And all of this has been done in an effort to start building collective will for transformative policy change. And so, the result, there's some, I don't have a ton of time. I want to share some things that really stood out to me and what made this, well, actually, let me share what's happening with it, and then I'll come back to that. So, all of this together, it's been, so that's what, like around 14 months of work together. And this month, we're going to be releasing a documentary about how structural racism in programs, policies, and practices harmed 4 Black communities in Cincinnati. With that, we'll be launching an advocacy agenda that highlights concrete policy opportunities that could move Cincinnati closer to racial equity. And also from this coalition work, we've created a community leadership development program that's going to culminate with an advocacy project. And we're piloting all of that right now. But what I was going to say is about some of the lessons that we've learned is that this is really just an example of the reality that there's a strong appetite for racial equity work and addressing racial trauma. And some things that were really beneficial to what we were able to do and allowed us to have success in Cincinnati, Ohio, which is one of the most segregated cities in America, is, we put in the time building the foundation with the coalition. We were able to leverage and have a strong community engagement angle, which you'll see, we did some parent and youth listening sessions. There was a webinar series, a public art exhibit. We've got this documentary. There were community conversations. We tried at every phase of this initiative to bring in community voice, create opportunities for community learning and opportunities for us to listen to what people had to say. And I think the sort of underrated or maybe unexpected value of that from my perspective is that there was healing in that process in and of itself, for both the coalition members who were at the table, but also for the broader community. And I think that's so powerful when you think about, how our work as folks in the trauma-informed space is not only advancing that, is not only helpful to the people that we work with and the people in our communities, but there's a healing aspect that sort of roots through us as well. And then I think, again, just, when we think about the fact that to change systems and structures, we have to get really deep and dig into the roots of policies. And that's, big P policy and also little p policy. And I think what's really exciting about what we're doing here is that we have some really clear-cut opportunities and some willing advocates, and not just at the institutional level, but we're building power for advocacy in the community, which I think is also so important for sort of spreading the reach of this work, and almost like an each one teach one sense. When you can build the capacity of community, all of the strengths that they already have, they can coalesce those around that. And I think so much can happen. So, I hope what you take away from all of this is that we, as, again, people committed to building trauma-informed communities, have to be willing to make some active shifts in thinking, in our planning, and in our doing. And that really requires, sitting with what's uncomfortable, being responsive and accountable to the emerging needs of communities, and really being intentional about who and how we engage. And this isn't easy work, right? But neither is what we're working toward. Trauma-informed work is, we're trying to change the culture and the ethos of America so that every person in every community has the resources and the supports they need to feel whole and thrive. And so, pushing against obstacles that feel complicated and immovable today is really going to clear the way to the trauma-informed world that we hope to see tomorrow. And so, for me, it was really such a pleasure to be here with you all today. And I look forward to seeing what we can accomplish together in this movement. So thank you.
Oh, that was just excellent. I think everybody is feeling really energized, even at the end of the day on a Friday, listening to the guidance that you had, Kimberly. And it wasn't just, step by step, this is what needs to be done. There was a lot of philosophy embedded in what you've said that gives one pause and makes one think about our approach to these really complex issues at hand. So I thank you very, very much for that presentation. And I look forward to hearing more from you in the future. We are going to pivot now, and we're going to go to the Jamboard. I don't have access, I haven't seen it, so I'm excited to hear what Wendy Maris has to say about what people have provided in terms of input into the Jamboard. So I'm going to introduce her, and then you're going to take us wherever you want us to go. Okay, Whitney is a licensed master social worker in Virginia. She is a graduate at the University of Buffalo School of Social Work, where she obtained her Master's of Social Work degree with a focus on trauma-informed care and human rights. She is an original core team member and current co-chair of the National Trauma Campaign, and she also works as a consultant with CTIPP. Whitney has broad experience ranging from training and coaching to advanced organizational and systems change, to direct clinical practice, to both private and community-based settings. So we are really looking forward to hearing what you have to say about input from this community, the trauma community that we have here.
Beautiful. Thank you so very much. I am going to share my screen here. And I also am going to quickly drop a link for the Jamboard right in the chat so people can follow along. So glad to be with all of you. Oh, wow is all I have to say. I won't spend too long, but woof, so struck by everything. And thanks to all of you who have contributed to our first workshop sessions, Jamboard. I'm sharing the link again in the chat. I just dropped that. And this is our first time using it in such a, shall we say, robust group. And so we learned that there's a capacity limit today, which is excellent knowledge for us to consider moving forward. All the best laid plans, right? And honestly, having such active participation is a pretty great quote unquote problem to have encountered. So thanks again to each of you who's continuing to contribute to this powerful dialogue. I've been trying to take items from the Q&A and the chat so we could fill things into this Jamboard as a central location. And just want to do a bit of an abbreviated overview to synthesize some of what we've been hearing from you. And those of us orchestrating this workshop series, by the way, just want to put this out there, we'll be meeting together to debrief and improve upon our first session next week. And we certainly will discuss what might be possible in the way of organizing and sharing this and other rich information that was shared in the chat and otherwise, ideally one that will allow for continued interaction and engagement, because there's just an enormous amount of wisdom that we're about to go through and so much insight in this community that we would just love to provide opportunities for you to share so we can lift up your comments in our follow-up outreach. So with that spiel out of the way, let's take a look first at some of the more general questions and wonderments submitted. And again, this is not exhaustive given how much is happening in the chat and Q&A. And some of these are really specific to our workshop series. And please continue to deliver that feedback. We know we will adjust our approach a bit by providing agendas as is proposed here and some additional suggestions about what we're hearing folks would like to see happen in our future workshops, like objectives, a summary statement for the topic, things like that. And amongst this feedback are also some more general questions and wonderments about our topic today that folks put out there for consideration, from thought-provoking questions related to shifting the focus from being reactive to being more proactive and preventative in our efforts, to questions about research and data that's out there, to wonderments around what has worked for folks in the way of reducing re-traumatization, what states do and do not have offices of resilience. People were really struck by our New Jersey guest, and what folks might be able to do to prevent or to help this be something that's more prominent, this Office of Resilience, and how can we be strategic about our advocacy and integrating racial and equity and historical and cultural trauma into our action frameworks, to what strategies work to engage the community and those who are most impacted by the change process that we've addressed today. There's also some thinking that we're seeing around advancing this conversation when there's hesitation to investing in long-term community learning, listening, and growth, and brushing up against conflict in our advocacy efforts. And so again, you can continue to contribute to this. If you have thoughts and answers that you want to share, insights and wisdom from your lessons learned, please go ahead and you can retroactively add these. This Jamboard will be open for you indefinitely. And next, I'm going to expand to our next section. We have some really excellent key insights that were shared out. And again, we'd love for you to continue to add in terms of what's striking you most, what your key takeaways are from here today, and other insights that you're willing to share. And folks really are emerging from this experience, it seems like, thinking about the need for a national community of practice, as was just lifted up in conversation, to really support this work with resources and technical assistance. And there were some important conversations about how vital it is for us to consider being trauma-informed and resilience-informed through a racial justice and equity lens. There's again an important statement on the significance of engaging and centering voices of lived experience, as was just so beautifully captured, and how to assure that we adopt a more holistic approach that doesn't just, quote unquote, focus on ACEs, because as we've all seen today, and as we all know just by virtue of being in this community and sharing this learning together today, there are so many layers and there's a lot of nuance to this beyond, quote unquote, just ACEs. And so there are some profound observations about the importance of peer involvement that appeared in the chat. Great conversations there. Certainly a central principle in the trauma-informed work that we do. And finally, I want to lift up also in the green post-its there are Dan's action steps that he shared out during his exceptional presentation of information today. So these are here for you to return to, consider, reflect on, think about. And I'm going to show you the next section that we can navigate to here is the community toolbox. This is a page filled with resources, and we have been scrambling really to sort of capture some that appeared in the Q&A and the chat. There are so many that we are going to go back and share out in our outreach following this workshop. And again, we're considering the best way to consolidate this information and really invite you to share any and all resources on these pages, even retroactively, even after we've closed for the day. You can come and drop some resources on here, and we'd love to include them and lift them up in our communications. And please know that you can also contribute, as this next page shows, with images in addition to the post-it notes and the text. And I really want to circle back specifically to this fabulous infographic used earlier in the workshop and give credit where credit is due to the North Carolina Partnership for Children. Just want to lift up, this is their beautiful work. And feel free, infographics, things like that, that you think could be useful in conjunction with things that have been shared out today. We would love to see what you have out there. Ooh, someone's making it bigger. I love that. So as you see, any action you take here is shared and visible by everybody, which is sort of the magic of this engagement strategy. And there's just an abundance of rich resources for your exploration here. Next, we have our parking lot, so to speak. And this is where we've placed specific questions, thoughts about that pertain specifically to our presenters and panelists today. And we'll be working to get you responses and to share more resources and insights based on what you're thinking about, what you're noticing, based on what's on this page here or anything that you add or sent us in the chat as well. I'm sure that there have been many ideas and wonderments that will emerge now and also retroactively. So again, feel free to come back. We will be reaching out to our panelists to get you responses as needed. I'm going to go ahead and also show you this last section. We've provided a space for you to share action steps, and we would invite you to share how you're making meaning of all this information. What do you feel your contribution to this movement is after hearing all of this great information? And you'll see some folks from Pennsylvania have already contributed and have decided that they'd like to continue to connect and devise some concrete steps to coalition building themselves, which is absolutely thrilling and a wonderful use, hopefully, of this space. making connections in that way. And again, I do want to plug CTIPP's National Trauma Campaign, which also is a wonderful resource to get in touch with local and state leaders across the country who you might be able to join and build bridges with, so you can all work together in ways that do not necessarily replicate efforts and that successfully increase your power as a coalition or advocacy group. And if you're interested in doing that, feel free to drop a post here with your information. We'll certainly share that out as long as you're comfortable doing so. And the final thing I want to touch on is that, as you'll see here through the top sort of navigation pane up here, I suppose we could call it, there are several blank pages that we've added in anticipation of all of you coming back and sharing your wonderful, striking thoughts with us in the future as you continue to reflect upon and digest this information. And again, we are so appreciative of your thoughtful engagement and welcome any and all thoughts you have on how we can continue to support meaningful engagement in this amazing community using Jamboard or otherwise, if you've had strategies that have worked really well for you as this workshop series continues, because we are in this for the long haul and really look forward to amalgamating all of this information and sharing it out. So much power in this room, virtual space, I suppose, virtual Zoom room. And with that, I think that's what I really wanted to lift up myself. I would invite anyone else to make comment to this. Jesse, if you had anything you wanted to say, otherwise I'll pass it right to Denny.
Thank you, Whitney. I have nothing more.
Great. I know you were monitoring the chat. Kudos to everybody on team, by the way. I have to give snaps to folks just because this has been a real team effort getting all those questions in there and monitoring the chat. So just want to shout out.
And the chat has just been our fast moving train. But we will see it all later for sure and be able to weed through and get all the resources out of it. Two things before you all leave. First of all, I want to tell you about our day 2 session, which will happen on January 21st at the same time frame, being on the East Coast from 1 to 5. And from 10 to 2 on the West Coast. We're going to have a tremendous session, equally as good as this one. We start with the educational system, and Lee Johnson from 0 to 3 will be moderating that. We have folks from the University of North Carolina, the Urban Assembly, Florida State University, and the Pennsylvania State Department of Education. And the second part of that session will be on the healthcare systems. Sandy Bloom will be moderating. We'll have folks from Emory, primary care 0 to 5, Dr. Laura Jana, Sandy Bloom, who is in behavioral health, Angela Diaz from the Mount Sinai Adolescent Health Center, and Denise Smith, National Association of Community Health Workers. So we are really jazzed about that session. Please join us. Now, also, I want to tell you that we are having, we would provide wine and cheese, but obviously it's a little difficult to fax these things. But we would like to have you join a breakout room that we will construct, and it will just randomly put people into smaller groups that can discuss the work that has been presented to you today. Jesse is going to talk to you about that, and so will Whitney.
So Whitney has a facilitation guide that we can get into in this new Zoom room. The one thing that hasn't been stated this whole time is that this, and huge kudos to the whole team that helped put this on. This was unfunded. No organization had any funding to put this on. We still don't. We are hopeful that we built something that will be able to be replicated and improved upon in years ahead, where we will be able to get funding to make the rooms more complex. There is not a breakout room capacity within this webinar style. And so we weren't able to do breakout rooms during the sessions. Again, these are capacities that will be able to be shared, but I just put a new Zoom link in the chat for those who are interested. We invite you to join a new Zoom room, or a new Zoom room after this final conclusion for the first day is on, so that way we can facilitate those breakout rooms. We wanted to engage participant involvement, which is why we had the Jamboard, which there were technical problems with, and why we have the breakout rooms for afterward for those who are interested. For those who are not able to join, we understand the fact that you've been on for 4 hours is commendable, and we appreciate everybody's involvement and engagement throughout this afternoon. We really, really do. But for those who are interested, I'll just put it in the chat one more time. We invite you to join a Zoom room where we will do breakouts for the next hour from 5 to 6 Eastern time, 2 to 3 Pacific time. For those who have wine and cheese available, we invite you to bring that along as well. And we'll be making sure that we do this for each of the following 7 workshop series as well.
Or tea.
Or tea, or whatever beverage and snack
Right.
of your choice. We just want for everybody to be comfortable.
Right. Whitney, did you want to give any direction for the breakouts?
Absolutely. So before we all navigate over to that Zoom link, just want to let you know that we have provided a guide in the chat. I dropped a file. I'll also drop it in the breakout rooms. I also know Zoom can be persnickety, so I also gave you a Google Drive link where you can download the discussion guide. We're providing that document just as, you know, a framework for you to use or not use. You certainly can, we invite you to discuss whatever else you're noticing or wondering or thinking about that doesn't appear on this document. They're just there to sort of anchor you in the conversation we've had today, help you connect, and we will provide, we'll keep the breakout rooms open, as Jesse mentioned, for an hour, though you certainly don't have to stay. You can certainly use your best judgment on how long you want to stay and have that conversation. And we hope this document is just helpful in keeping this rich conversation going. And the one thing that we ask is that you take a look and hold yourself accountable for upholding our community agreements, which we hope help keep your conversations feeling mutually respectful, safe, productive, and enriching. It's on the second page of the document that I linked to. And for those of you who are signing off for the day, we're so grateful and humbled by your presence. Meanwhile, for those of you who do wish to stick back and spend your time in conversation in a breakout room, we'll be putting you in your rooms in the other link, and we're also available for questions. You can raise your hands in the breakout room and we will come to you. And you also can exit your breakout room to the main room and we can answer your question in real time and pop you back in there. So that's sort of the overview, I think. I guess I'll see you in Zoom.
And just so folks have it one more time, the links there one more time.
Because it's all about developing relationships.
Absolutely.
That's what you can do in a Zoom room. So thank you all so much. We'll see you in 2 weeks.